2021. I call this meeting of the DuPage County Board to order. I do not believe that there is a physical quorum present. I have confirmation of that. So as I call the meeting to order, we know that a physical quorum is not present. However, pursuant to Section 7E of the Open Meetings Act, members are permitted to attend remotely. Either one member of the committee, the chief administrative officer, or our legal counsel are physically present, and we know that, at this regular meeting location. In-person attendance and public comments are allowed, subject to attendance limitations required to ensure the health and safety of those who attend. So I would like to call on Member Schwarzy, if you would be kind enough, sir, to lead us in the Pledge of Allegiance.
Thank you. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, for justice and liberty for all.
Amen. All right. That was very nice. Okay, so we move on to the next order of business, our invocation, and I'm so pleased to welcome the president of the Islamic Center of Naperville, Kashif Fakhrudin, to lead us in invocation. Please proceed.
Thank you for giving me the opportunity to offer the invocation. In the name of God, the most beneficent, the most merciful, the most kind. On this day, we thank you for everything you have given us. We thank you for everything you have taken from us due to your ultimate wisdom. Allow us to be amongst the most grateful worshipers. Our Lord, forgive us, guide us, heal us. We ask you to heal those who are ill, bring solace to those who have lost their loved ones, and protect us all. We ask you, our Lord, to lift the pandemic from this earth. We ask that you set right our affairs, that you be with us every step of the way. Do not leave us to ourselves, even for the blink of an eye, for you are ever living and most powerful. Our Lord, we pray that you allow us to see the truth as truth and allow us to see the falsehood as falsehood and stay away from it. We ask you to facilitate ease for us and grant us wisdom and justice so that we may serve our communities in a manner that is pleasing to you. Amen.
Thank you. Mr. Deputy Clerk, would you please call the roll?
Chaplain. Chavez.
Here.
Covert.
Here.
Desart.
Here.
DeCiani. DeCiani. Eckhoff. Garcia.
Here.
Hart.
Here.
Krajewski.
Here.
LaPlante.
Here.
Ozog.
Here.
Pachowski.
Here.
Renahan.
Here.
Rutledge. Schwarzy.
Here.
Selman.
Here.
Tornatore.
Here.
And Zay.
Here.
Okay, thank you, Mr. Clerk.
Show member DeCiani present. Thank you.
There he is. We move on to the order of business entitled Chairman's Report, and we have a presentation on an important subject matter that we have addressed and that we address annually. And I'd like to invite member Liz Chaplin and Karen Ayala to be at the ready. I would invite you up to the podium, but we're not doing that right now. Each year, we offer a proclamation that seeks to raise awareness of Kawasaki disease, an illness that comes on suddenly, usually strikes young people, and causes a host of unusual symptoms that can be very dangerous. And unfortunately, in a year in which the COVID-19 pandemic seems to have worsened the health of millions, well, it has worsened the health of millions, it has also mimicked the symptoms of Kawasaki disease, which is really troubling and challenging, and for a disease that impacts predominantly children. So we have asked our DuPage Health Department Executive Director Karen Ayala to join member Liz Chaplin for this year's annual Kawasaki Disease Awareness Proclamation so that we can learn more about some of the new health information related to this illness. I'm going to read the proclamation, and then I will call on Karen and Liz to help us learn more. So with that, the proclamation is as follows. Whereas DuPage County recognizes Kawasaki disease as a serious illness characterized by inflammation of blood vessels throughout the body, primarily affecting young children, and can lead to permanent heart disease, lifelong aneurysms, stent placement, heart transplants, skin disorders, and childhood anxiety. And whereas Kawasaki disease, more commonly known as KD, is the #1 cause of permanent heart disease in children and is diagnosed in approximately 5,000 U.S. children annually who are primarily under the age of 8. And whereas recent instances of young adults suffering heart attacks in their 20s and 30s show evidence of old aneurysms and a missed diagnosis of Kawasaki disease, or KD, as a child. And whereas after the start of the COVID-19 pandemic, clinicians discovered some children who had been diagnosed with COVID-19 had experienced a new syndrome resembling KD called multi-symptom inflammatory syndrome in children, and is characterized by persistent fever, rash, hypotension, gastrointestinal symptoms, and organ dysfunction. And whereas this inflammatory syndrome in children, multi-system inflammatory children and syndrome in children, MIS-C, we'll call it, may begin weeks after a child is infected with SARS-CoV-2, the virus that causes COVID-19, and the child may have been affected from an asymptomatic contact, and in some cases, the child and their caregivers may not even know they had been infected. And whereas the American Heart Association, the World Health Federation, and the National Institutes of Health recognize the need for proper and timely diagnosis, education, and treatment of KD, and whereas the lack of public knowledge and understanding of the disease plays a significant role in the overwhelming numbers of undiagnosed and untreated cases of KD, and the dissemination of inaccurate, misleading information contributes to the obstacles preventing diagnosis and treatment of the disease. And whereas there is a need to educate healthcare professionals, parents, and the general public about the disease, particularly since people could be unknowingly at risk. And whereas studies by the Kawasaki Disease Research Center consistently reveal that through proper and comprehensive diagnosis and treatment, the symptoms and effects of KD can be substantially decreased and quality of life for the individual can be improved. Now, therefore, be it resolved that I, Daniel J. Cronin, Chairman of the DuPage County Board, and members of the County Board do hereby designate January 26, 2021 as Kawasaki Disease Awareness Day in DuPage County, and encourage DuPage County residents to find out more about the signs and symptoms in order to seek the appropriate treatment and care. I'll entertain a motion on this resolution. So moved by Member Chaplin, seconded by Member Garcia. All those in favor say aye. Opposed, nay. The ayes have it. This resolution is adopted. And let me ask Karen Ayala and then Member Chaplin if you'd be kind enough to offer some words on this subject matter. Please proceed. Member Chaplin,
Yes,
please.
I'm here. Thank you so much, Chairman Cronin, and thank you to the board for passing this resolution. So I believe the first resolution that we passed recognizing Kawasaki disease was in January of 2014. This year, more than ever, it's really important for people to understand the signs and symptoms of Kawasaki disease. I never thought in 2014 when we talked about this, Kawasaki would be associated with a global pandemic. And Karen is going to talk about that a little bit more. But as mentioned, Kawasaki disease is the leading cause of acquired heart disease among children. And it's a rare inflammatory disease that, as it was read in the proclamation, that causes the blood vessels to become inflamed and swollen throughout the body. And we don't know what causes Kawasaki disease, but we do know that 80% of children that get Kawasaki are under the age of 5. The hallmark symptoms of Kawasaki disease are a very high persistent fever that lasts for more than 4 days. In addition, a rash, red and swollen eyes, red swollen tongue and lips, redness and swollen hands and feet, and swelling in the neck, very swollen glands. The reason I come before the board each year to raise awareness of Kawasaki is because if Kawasaki goes undiagnosed, it can have a terrible, devastating impact on a child's life. But if a child is diagnosed within 10 days of the onset of a fever, and they get the proper treatment, they can grow to be healthy adults with no lingering side effects. So my daughter was diagnosed with Kawasaki when she was 7. We got her treatment probably on day 4 of her fever. She was misdiagnosed the first day we took her into the doctor. A couple of days later, I took her back. They diagnosed her with Kawasaki. And that happens a lot. So you have to be an advocate for your child or your grandchild or your niece or nephew or your neighbor's kid, whatever. So it's very important. It's very important to know that, those signs. So if a child is not treated within those 10 days of the onset of Kawasaki, they can end up with coronary artery damage that supplies the blood to the heart, which can cause inflammation of the heart muscle and the heart and lead to heart valve problems. And any of these complications can damage a child's heart. Inflammation of the coronary arteries can lead to weakening and bulging of the artery walls and aneurysms increase the risk of blood clots, which can lead to heart attack or other life-threatening internal bleeding. So Kawasaki is prevalent in the spring. So please let your family members and your friends know about the disease so they can watch out for their any small children that they might know. And I will leave this off to Karen Ayala.
Thank you so much. And not only is it a pleasure to be coming back in front of the board and the community again to talk about Kawasaki's disease, because it is such an enigmatic type of a disease. It presents and then, as Member Chaplin indicated, often subsides, and unless there is that intervention early on, there are life-threatening and life-changing implications. What we saw early in the pandemic, and again, history will call where we're at currently still early in the pandemic, but we saw early in the pandemic that there were children that were experiencing very similar symptoms to Kawasaki disease as a result of coronavirus 19. And in many cases, the symptoms mimicked specifically the symptoms of Kawasaki disease. And again, it is incumbent upon practitioners and parents to advocate and provide that differential diagnoses, because similar to how there are treatments to address the long-term implications of Kawasaki disease, there are also implications in treatment to deal with COVID. I think it's important also to recognize and acknowledge that although the symptoms in children with COVID-19 have primarily been less severe than their adult counterparts, we still don't understand why there are certain children who have this multi-system inflammatory syndrome that's kicked off in their little bodies and creates so much pain and concern for them and their families. So we appreciate this opportunity, and again, welcome this opportunity.
Okay, thank you very much, Karen, and thank you, Member Liz Chaplin. I can honestly say that, when you brought this to our attention a couple years ago, I had never heard of it, and so you have raised the awareness, and so for that, you're to be commended. Thank you very much. Thank you, Karen. Karen, if you would please remain at the podium. Karen Ayala is also here today to bring us up to speed on the county health department. Their very important vaccination efforts, the health department's plans for the coming weeks, and I just lost my script here. Stand by. I have my daughter as my IT advisor here this morning, and she does a great job. Thank you, Elizabeth. So in any event, so Karen's going to tell us about what's going on and where we're going. And I know that this is a huge concern for all of us. I know, of course, it is for me. I don't think I can go anywhere these days and without somebody or numerous people approaching me, calling me, emailing me about where we are with the vaccine and when can they get vaccinated. So I think before Karen begins, it's important to note that DuPage has fully vaccinated more than 1.5% of the population. And you say, well, gee, that's not very impressive. But you know what? That's more than any other county in the state of Illinois. And so we continue to face vaccine supply issues. I have strongly advocated with Governor Pritzker and have been working well with his administration that DuPage receive its appropriate allocation based on our population and our significant ability to get vaccines in the arms at a rapid pace. Currently, our supply is rather inconsistent and certainly insufficient. But we are consistently advocating at all levels of government to rectify that situation. So, Karen, I know you have a lot to say or a lot of information to share, so please proceed.
Thank you so much. I have a lot of information to share and a lot to say, so thanks so much. And thank you, Chairman Cronin and distinguished members of the County Board for allowing me the opportunity to provide you with an update on our COVID-19 vaccine distribution plans, progress, and work to date. Joining me through the power of Zoom are other members of our Health Department leadership team, including Dr. Chug, Chris Hoff, and Adam Forker, amongst others. If you would, please go to the next slide. And the next slide. My comments will be, and discussion points will be divided kind of in three segments. First is the vaccine registration process that we've developed, answering the question, again, that Chairman Cronin alluded to, the questions we're most often fielding from our constituents and residents. Next, we'll talk about the goals and progress of our overall vaccination efforts. I'll provide an update on the global variants that are being identified. And finally, we'll discuss our region's mitigation progress to date. So let's move into this vaccination, mass vaccination 2.0. One of the primary challenges that we're addressing with our communities and our residents is that when we talk about a mass vaccination effort, most people's minds go back to their experience either with polio or with swine flu or with H1N1. when we had the opportunity to provide vaccine through one provider, one location in the county. It was offered on a walk-in basis. There was the potential for people to stand in long, long lines for hours. It required extensive resources from both the health department and the county. But most importantly, it required substantial quantities of the vaccine, which simply don't exist for our current challenge, COVID-19. The positive of that traditional mass vaccination clinic is that people could easily identify the next step. They simply had to show up at a certain place and then be willing to stand in line long enough and they would be vaccinated. The downside that we look at that is not only are vaccine quantities restricted, but we also realize that with the substantial continuing spread of COVID-19, a vaccination site such as those of the past could become a source of a significant viral spread, which is the last thing we want to do. So our mass vaccination efforts 2.0 in DuPage County, and again, each county has the opportunity and the ability to arrange and develop their own strategies for vaccinating their residents. So in DuPage County, we are utilizing new and existing community-based providers. We will be offering and are offering many locations available throughout DuPage County, including pharmacies, physicians' offices, health systems, and employer-based opportunities. At this point, all of the efforts and all of these opportunities will be appointment-based. We want to make sure that these offerings are convenient and meet the multiple needs of the multiple constituents that we have in our community. And finally, we want these efforts to be efficient so that we can scale up and down to meet vaccine availability. Next slide. So in DuPage County, in order to get even in the ballpark with what our vaccine goals are, we start at the very end. If we use the 2019 census figures that DuPage County has 922,921 residents, of which 715,263, or roughly 78%, are above 18 years old. We set a goal at a minimum to vaccinate 80% of our population over 18 years old. That represents the number of 572,210. Now, how are we doing that? One of the ways is through our vaccine registration process. Our vaccine registration process was actually launched in November. However, we recently, in the last several weeks, refined our vaccination registration form, and you can now find it located at the dupagehealth.org/COVID-19 vaccine webpage. The purpose of this registration form is twofold. First, to inform residents about the vaccine distribution process. We are getting a lot of concerns, a lot of frustrated people thinking that perhaps we have vaccine, but we're not offering the vaccinations. And so on that site, you will find information about how much vaccine we are acquiring. More importantly, and more specifically, however, the registration form will be used to inform eligible individuals about vaccination appointment availability. And when there is sufficient vaccine and clinics are set up, they will actually get a link to that site. So let's walk through what to expect as we use this registration portal. Step one is to visit and make sure that members of the community have visited the registration portal to get started on their vaccine journey. The other way, or another way currently available to them, is to sign up directly through a community-based provider, whether that be a pharmacy or through a medical provider. Some of the large primary healthcare systems and health systems are offering text messages to their patients who fall into these eligibility categories. So either way is fine. The resident then fills the form out and they receive an email confirmation from the health department. Next, residents will be prioritized based on the CDC and IDPH criteria. And importantly, we or our local healthcare partners will email registrants when more COVID-19 vaccine appointments become available. A lot of people worry that they submit that information, they get the initial email saying that they're registered, but then if they don't hear within a day or two, they're concerned that perhaps they might have fallen off the list. So we want to assure people that that list is maintained. We will be sending a brief update once a week to help keep residents informed while they wait. Excuse me. Information in that update will be how many appointments have been provided throughout the county in the last week. Have there been any changes in the priority groups? Have there been new vaccine providers added? Ultimately, residents will be contacted by the health department to schedule an appointment based on their eligibility and the vaccine supply. And as their appointment date and time is offered, residents show up at whatever vaccine site is indicated to them to get their first vaccine dose. We are utilizing a decentralized, community-based model for vaccination that, excuse me, that leverages the benefits of public-private collaboration. Questions on the vaccine registration process?
I have a question.
Sure.
Question is it member Amy Chavez?
It is. Thank you. So I was wondering, do you want people to register only if they're in an eligible group right now, or ideally do you want every resident to register, or will that overwhelm the system?
Great question. It will not overwhelm the system. However, we're trying to set expectations with people. So even if individuals may not be in that eligibility category, they may become increasingly impatient. Either way, they can register, though.
Further questions? Further questions? I'm scrolling through. I see Member Schwarzy. Member Schwarzy.
Thank you. And please let me know if you can hear me. I've been told my audio was cutting out earlier. So, okay, good. If residents register via their healthcare provider, who will they get the email from when it's their turn? Will that come from their provider, or will it come from the health department?
If they register with their provider, it will come from their provider.
Okay.
And I apologize. Let me just take a minute and get my throat cleared.
So I've been advising people to sign up, register, avail themselves of every avenue, their local hospital, DuPage Medical Group. Anybody that's got a My Chart account should be sort of plugged in, and they should be putting themselves in a position to be notified when the vaccine becomes available. Anyone else have any questions here? I see Member Ozog. There she is. I think Karen's catching her breath right now, but go ahead with your question.
Okay, my main question is, I've noticed on social media that people who are affiliated, their doctors are affiliated with DuPage Medical Center, are getting appointments and actually getting the vaccine. And those of us who are with Northwestern Medicine, so these I would say are the two largest private providers. Northwestern Medicine doesn't seem to have anything going on right now. No My Chart notifications. I'm just curious if Director Ayala has any insight into that. And yeah, I mean, I agree with you, Mr. Chairman, about signing up anywhere you can, I guess. But I'm curious that why these two major providers would have this discrepancy, or what appears to be a discrepancy.
According to social media. Karen, you want to answer that?
Sure. So we meet with our healthcare system leaders on a weekly basis. And each of them are taking a slightly different tact to informing and reaching out to their patient load. I think it's very important to understand that people who are getting notices from DuPage Medical Group, what we were told this morning is that they have been evaluated and assessed based on an algorithm related to their risk for COVID, to need vaccine or be at risk for hospitalization sooner than others. Oh, I'm so sorry.
Okay. Any further questions? I see Member Renahan.
Thank you, Mr. Chairman. Karen, I hope you're okay over there. I'm going to go ahead and ask my question.
We need you.
Yeah. So, Karen, thank you for all you do. And this is a question I'm asking just because it's been asked me so many times. I think there's so much suspicion out there in terms of what's going on in Cook County, and my grandparents or my parents could go to somewhere else out of county and get the vaccine, and yet we can't. You know, what can I tell these people? I think we're taking a break here, maybe?
Yeah. Karen's trying to regain some.
COVID isn't the only thing going around. Indoor allergies are a problem too.
So sorry.
I apologize. So, yeah, there are lots of people who have conspiracy theories about the vaccine process, and I think it's unfortunate because many of those are being shared, and not all of those have elements of truth. So people are able to register vaccines everywhere. However, that doesn't mean they can access a vaccine. And I think that's really important to understand. Also, I think it's many of our systems to register and receive vaccines are based upon individuals' ability and willingness to correctly and accurately report their eligibility status. And so for people who are perhaps more desperate than others, there is the opportunity to kind of jump in line. So it's not a perfect system. What we're trying to do is work to make it as efficient in DuPage as we possibly can.
Further questions? Scrolling through I see Member DeCiani.
Thank you, Mr. Chairman. Karen, what's the future looking like? I know our testing center at the fairgrounds is going to be closing at the end of the month. Is that going to be turning into a vaccine center where people could, come in masses? Do we have a future plan here? And I'm assuming we will be offering some sort of mass vaccination when the inventory is available. But can you give us a picture of what that's going to look like? And is it going to be partnership maybe with the National Guard, or is it going to be administered by us, or what?
Sure. So let's move into what our vaccine planning goals and progress actually is, which is the next part of this presentation. This information is as of Monday. It identifies that 54,655 DuPage County residents have received at least one vaccine, and that 15,000 persons have been fully vaccinated. Now, when you compare 15,000 to 922,000. It's slightly underwhelming. But if you compare this to a month ago, there were 0 individuals, or 7 weeks ago, there were 0 individuals, we've gained quite a bit of momentum. Again, this information is on the IDPH website, and it represents people who live in DuPage County, regardless of where they were vaccinated. We are very pleased to be in the top tier of counties. Yesterday we slipped to number 2.
Oh, how did that happen?
A little bit behind Stark County, but they have far fewer residents. We're pleased with this distinction, however, for 2 reasons. It moves us quicker to our 520,000 individuals that we need to get vaccinated to reach that 80% threshold. And it also indicates that our residents are embracing this opportunity and the vaccine. Next slide, please. Even with that success, however, we know that there are issues of concern that may prevent residents from getting this immunization. So we need to address these and would ask for your help with doing so. Some of the concerns that have been expressed over people's willingness to get vaccinated include their concern about the testing, safety, and efficacy of the vaccine. We want to reassure people that, yes, this vaccine was developed quickly. However, scientists had a head start. The vaccines were built on decades of work to develop the vaccines for similar viruses. The vaccines themselves have been tested for both safety and efficacy. More than 70,000 people volunteered in clinical trials for the 2 vaccines. Volunteer included individuals from all racial and ethnic backgrounds. And to date, the vaccines are about 95% effective in preventing COVID-19 with no serious safety concerns noted in the clinical trials. Other constraints for individuals getting vaccinated may include, well, you know, when I get the flu shot, I get the flu. So I don't want to get COVID from the COVID vaccine. And we want to assure people that you cannot get COVID-19 from the vaccine. You may have temporary reactions like a sore arm, headache, feeling tired or achy for a day or 2, but that is not COVID. That is your body's immune system doing what it needs to do. The shot is available, the vaccine is available at no cost. It is available to everyone, including individuals who do not have health insurance or legal immigration status. The 2 vaccines that are currently available require 2 shots, and that's designed to build their immunity. So with Pfizer, you need to come back in 21 days, and Moderna, you need to come back in 28 days for that 2nd dose. Finally, we won't eradicate COVID-19 only with our vaccine efforts. We need to continue practicing the 3 W's, the masking, wearing a mask, watching our distance, and washing our hands until everyone has their shot at fighting COVID-19. So let's talk a little bit about the phases. We know that this has created a great deal of angst because for decades, our populations are used to accessing whatever healthcare resources that they needed whenever they wanted. So the idea of prioritizing this vaccine is something that is very challenging for us to conceptualize and to realize. However, phase 1A, which is the phase that we're leaving right now included healthcare personnel and congregate care staff. We identified probably 6 to 8 weeks before we would move through that. The next phase is 1B, which is frontline essential workers and those aged 65 and up. Talk a little bit more about the scope, but we're anticipating about 12 weeks. Next comes individuals who may have already received their vaccine in either A or B, but it's persons aged 16 to 64 with medical conditions that increase the risk for severe COVID-19 outcomes. And finally, the rest of the population. There is a great deal of concern, confusion, frustration, and even anger over the phases and who belongs where. But ultimately, it comes down to a simple supply and demand equation. So what will impact the demand of vaccines? Whether or not people have side effects when they receive the vaccine. Whether or not the requirement to quarantine if vaccinated can be lifted. Whether or not we require as a country vaccine to be able to travel or to go to work. If I'm vaccinated, can I take this mask off? On the flip side, elements that will impact supply include figuring out where we're at with our federal allocation of doses of vaccine. Do we or do we not have, as a country, a stockpile of vaccines that can be released? Can we increase production for the Pfizer and Moderna vaccines? And how quickly and safely can we move additional vaccines into our process? The timeline, as I mentioned, for, next slide please, for the vaccination of 1A, roughly 60,000 individuals, was about 7 weeks. In spite of the very positive outcomes we have experienced in DuPage County, every day, myself and I'm sure some of you get emails from residents complaining or concerned about the failure of our ability to effectively distribute these vaccines. Another area that I'd like to enlist your support in is to help reassure residents that in spite of the many challenges, there will be vaccine for everyone who wants it, and that DuPage County is in fact leading the state on the most important outcome for this phase of our response, getting our residents fully immunized. Next slide that I've shared previously is the fact that these phases will overlap. Typically what we look for is that we've got a substantial number of persons in the current phase vaccinated, at least 60 to 70%. We'd also like to see, as these phases are larger and larger swaths of population, is that we have more vaccine available. That is not the case in this early round, but it's something that will impact and influence our ability to move on from here. So what is ours to do at the health department? The health department has provided an air traffic control role for allocating vaccine. We move roughly 13,000 doses per week to our partnering healthcare providers. We have also worked to identify and increase the number of providers that need to be enrolled in iCare, the state's vaccine system, and coordinate with them to receive approval. We communicate to the community and other stakeholders about where to access vaccine, and we also have been leading and hosting vaccine clinics. How is the health department operationalizing this role? The next slide shows that, again, the federal allocation to Illinois is based on weekly numbers. IDPH then allocates and informs us on a weekly basis what our allocation will be. DCHD then allocates to our vaccine providers in the community, and we share the vaccine out from there. As a reminder, our planning landscape shifts weekly. And there are two broad misconceptions that I think would be helpful to address now. One is that the more providers we have that can provide the vaccine, the more vaccine we'll get in DuPage County. That is not the case. We get a set amount. That is, in essence, our pie. So if we have lots of providers who want to give the vaccine, what that means is they get less of the vaccine. And two, if that's the case, we should simply be requesting more vaccine. I want to be very clear, this is not an ordering process that we have with the Illinois Department of Public Health. We can't order up vaccine. They tell us how much vaccine we will get, and then we can distribute it. With that in mind, people may get their vaccine, and the next slide, from hospitals or pharmacies, outpatient clinics, employer-based clinics, or from the health department. We currently have, as of the 25th, 83 approved provider sites in DuPage County. But vaccine supplies are low, and for now, so we're not able to reach as many people as we would like. But once the vaccine supply increases, we have the infrastructure and the capacity through this network of providers to be both effective and efficient. So let's take a look at the limited vaccine supply and the vaccine provider numbers. And this number is slightly different than the one that you have on your slides that we emailed to you. Our first vaccine supply came to us the week of the 13th of December. And you see every week we have received a different amount of vaccine. We've been told for the last 4 weeks that our vaccine level, our supply levels will be consistent or kind of in a maintenance mode. But that has not been the case. Once we receive that vaccine, we send out to providers. And as we've been distributing vaccine, we've also been working on these vaccine provider availability because we want to make this as easy to get a vaccine for COVID-19 as it is for flu. The next slide represents so far the geographic disbursement of the vaccine sites that have been approved. Now, to be clear, because of limited vaccine availability, not all of these sites have access to vaccine. But what we see is that there are vaccines available throughout the county. What are the requirements to provide the COVID-19 vaccine? This is a pharmaceutical. It needs to be handled by health professionals. It can't simply be somebody wants to set up shop to provide this vaccination. So healthcare providers must be able to vaccinate per their scope of practice. There must be medical oversight and direction for vaccine. They must be approved through IDPH, which involves an agreement not only with IDPH, but approval through CDC. They need to have the ability to schedule appointments and to manage the vaccine process. And then finally, as vaccine becomes available, we will provide it to that provider. Let's talk just briefly about the priority groups. Skipping to the next slide. Another question that's come up is, why don't we only vaccinate individuals over the age of 75? Why are we concerned about younger individuals who potentially are more healthy? We know that older individuals are at higher risk of severe outcomes and death. However, the recommendations by both ACIP and IDPH take into consideration that we also have essential critical functions that must be addressed, and if they aren't, would create significant serious disruption or loss of life in our communities. So as we look at the prioritization for Phase 1B, we see, one more, yep. We see that there are individuals aged 65 and up, there's first responders, there's educators, there's people involved in food, agriculture, manufacturing, there's correction workers and inmates, postal service workers, public transit, grocery store workers, and shelters and adult daycares. 1C involves other critical infrastructure. However, there's still input being gathered by ACIP and IDPH and recommendations for that group, so stay tuned. And then Phase 2 will involve everyone else. We are looking, this is the last week of our testing site at the fairgrounds. We will be transitioning that in a couple of weeks to be a vaccination site. But again, that will be one vaccination site with 82 others available as well. Finally, variant virus. And Dr. Chug, if you're available, could you cover these next two slides?
Yes, sure. Good morning, everyone. So as Karen mentioned, there are variant or different SARS-CoV-2 variants, and that's not unusual. We know that particularly within coronaviruses, that as infection is spread, then there's increased virus replication, which introduces the opportunity for mutation. And then when that mutation is sustained and then replicates further, then that results in a new variant. So sometimes those variants can just be new without any change in the characteristics of the virus. But sometimes, as we've been hearing, it can either make it more easily transmissible or potentially more virulent, meaning causing more severe disease or death. So what we're hearing about more recently are concerns about, will the vaccines that are available now, will they still work against the new variants, particularly this one that originated in the UK. It was first identified in the fall, I think in September, and then has been had very promptly become their predominantly circulating strain, and then even in the United States is increasing in prevalence. And Chris, is there a next slide on this? Okay, actually, if we could go back to the previous one, I want to cover the last couple points. Just that the concern about the UK strain, or the new strain that originated from the UK that's now in many countries and is actually in more than 20 states in the US now, is that it has been determined to be more easily transmissible. And in and of itself, there are some early reports now indicating that it may be more virulent, but even if it's only more transmissible, that still proportionately leads to more people being infected, therefore more people being hospitalized, and then more people potentially dying. So because of that, all the more reason for us to be doubling down and implementing the measures that we've been recommending and following that we know to be effective, such as wearing a mask and physical distancing and good hand hygiene and avoiding in-person gatherings. And then now, fortunately, with vaccines not only on the horizon, but now being administered through the different phases, that will also help. The understanding is so far that the vaccines that we have will still be effective against these viruses, and at least relative to the originally circulating virus, the efficacy has been determined to be very high, 95%. So, and the vaccine targets different the vaccine targets different components of the virus. So depending on what aspect is mutated, we anticipate that it would at least have some remaining, probably still high level of effectiveness even against a new variant. But we won't really know until they are doing some lab studies to determine this, but then we won't really know until we have actual people, through society, like as we learn through surveillance, if those who were vaccinated and subsequently infected versus, not infected, we won't really know until time passes and with ongoing disease detection and monitoring of vaccination uptake. So, very important. All the more reason for us, since it could potentially be more infectious, is to implement the measures that are still required. So, as Karen mentioned, people are understandably asking and optimistically asking that, if I've been vaccinated, do I still have to wear a mask? If I've been exposed to someone who's infected, do I still have to self-quarantine? At this time, there is no change in the public health recommendations based on vaccination status. And that's largely because so few people in society have been vaccinated. So we're nowhere near where we want to be to reach herd immunity. And we don't know exactly what percent that is, but the higher, the better. We hear Dr. Fauci talk about a minimum of 70 to 85%. And if this virus is even more infectious, then it would need to be even higher to offer community level protection against it. So that's one reason that we're at such low levels so far, since we're so early into our vaccination campaign. And then the second reason is because we have still quite high levels of community transmission. So the exposure risk is still very high. So that pretty much covers the overview of variant viruses. Can we go to the next slide, please, Chris? Yeah, so we talked through this, that all the more reason to still practice our 3 Ws and reduce spread as much as possible. And as vaccine becomes available to eligible persons, we urge everyone to be vaccinated as they're able. Next slide, please.
Thanks so much,
Thank
Dr.
you.
Chug, and I can pick it up from here. Just again to summarize, this is the landing page for registration, vaccine registration. What I didn't do is explain, and I'll just do that very quickly. We now have 141,000 names, addresses, individual people who have signed up on this vaccine registration page. What we do is match them. We have a healthcare partner who says they can do 3 clinics this next week with 500 people at each. We take 500 names and send that to that vaccine partner. They get those people registered. The next one comes in and says we can do 1,500. We then take 1,500 names and shift to that. We're opening clinics. We have 2,000 a week. We take 2,000 off of that. So we continue to work our way down that list. It's extremely important to get on a list. I encourage people to get on as many lists as they possibly can because it is the same vaccine. Doesn't matter where you get it. The other issue that member DeCiani asked about was the National Guard. We have in fact submitted formal requests to IDPH and IEMA for National Guard support. We have been told that our request is being considered, but at this point we do not have those resources. Finally, you have other pieces of information. One is key messages. What we tried to do is consolidate some of the information and the frequently asked questions that we were hearing. Frequently asked questions that you all have reached out to us about and provide you with some talking points. There's also an education and outreach resource page that's included in the email that Sally sent to you with the presentation yesterday. Again, we've updated that information. So finally, and this doesn't happen very often, to share some information about that has actually some good news. I want to talk about resurgent metrics. The state of Illinois announced this morning that we are being moved out of Tier 2 into Tier 1 of the resurgence metrics. We had been in Tier 3 for an extended period of time. We recently got our positivity rate back under 12%. So we moved to Tier 2. That positivity rate has now declined to 8% or below. So we're in Tier 1. What that means is that, again, indoor dining and bars are now eligible to open 25 individuals, limited to 25 individuals or 25% capacity, as well as some of the other measures. The next, if we keep doing well, then we can get back to the phase 4 of our reopening plan, with phase 5 being the full reopening. So we're very excited about that. That doesn't happen by chance. It happens because people are abiding by the mitigation efforts. So as good of news as it is that we're going to be able to get open and people are going to be able to get out and about, the concern, of course, is that unless they do it safely, we'll be bouncing back up into more constrained kind of requirements. So I apologize for the interruptions and the length of the presentation. Any other questions?
Karen, that was great. Very, very, very comprehensive, very informative. Is there any questions from members of the board? I'm looking across, scrolling through all your lovely faces. I don't see any hands in the air. No, I see Member Garcia, forgive me, and Member Zay. Sorry about that. Please proceed, Member Garcia. You're on mute.
Yes, thank you. Karen, first of all, thank you so much for all of your team's hard work. I know my family has been at your facilities getting tested often this last month, unfortunately, and you guys do a great job. I know this is probably a question you don't want to hear, but I have not heard any clarification on if we get vaccinated for this, is this going to be a one-time shot or is this going to be something we have to get yearly? You know the answer to that.
Dr. Chu?
Sure. Sorry?
After 2 shots.
Right. So currently, just because we're so early into the journey with vaccination, we do not know yet. The individuals who were part of the trials, the vaccine trials, are continuing to be studied to see how long their protection lasts. And then also going forward, individuals who are vaccinated through disease surveillance, and that vaccination status has now been added to the case report form for COVID-19. So we can track disease activity among vaccinated persons. So I think all these data through research and through surveillance will help inform the recommendations going forward as to if and when a booster dose is indicated.
All right. Thank you very much.
Thank you.
Member Zay.
Thank you, Mr. Chairman. Thank you, Karen. My question was, I know you work with IDPH, and it goes down to the breakdowns of 1A, 1B, and 1C. And something that you had brought up, the words you'd use are critical function. On a day like today, I don't understand how the state's doing this. I know it's difficult, but a day like today, I think our county employees, our snowplow drivers, our public works people, that's a critical function. If they're not out there, no one's getting around. I bring this up because we had an outbreak at the Water Commission 2 weeks ago where I lost a third of our employees, and we supply water to over 1 million people. And we've been now put back. We were on 1B, we were put back to 1C. And we sent a letter to the governor, but is there any wiggle room? I know things are changing daily that we can put a plug in for people like our government people, our plow drivers, our essential workers that we need for the function of government.
Yeah, absolutely. It doesn't hurt to advocate. These priority groups already, as you heard, our demand for the vaccine far exceeds the supply of vaccine. So I don't know that at this point, moving more people into the 1B category and then we can't vaccinate those people will be of any tangible help. I think our best course of action is to get as much vaccine into the community just as quickly as possible. And we are certainly very committed to making that happen.
Thank you.
Member Chavez, followed by Member Ozog.
Thank you, Mr. Chairman. My question is, I'm so sorry that you're having to deal with all this inconsistencies in the supply chain. I can only imagine how frustrating that must be. When I look at these numbers on week 3, we were at 5,000, I believe it's doses, not vials. But then in week 5, we go to 23. And I'm just wondering how you are handling those inconsistencies. And if we're holding back because we know that patients are going to need a second dose? Or are we assuming that the supply chain is going to get more consistent and we can go ahead and use up on a weekly basis what we currently have in stock?
So yes, to answer your question, and we are concerned about the inconsistencies. It makes it very challenging to leverage the full power of our partnerships, because our partners, if they could be assured of a certain level of vaccine on a weekly basis, they could set up those clinics and we could keep people moving through that. We don't have that level of assurance. However, we continue to utilize and rest upon the words that the second doses will come. If we get the first doses out, the second doses will come. And so we continue to push. These are doses that we allocate across our county to our partners and indicate that they need to be used within the next 5 to 7 days.
Great. And I just had one more, if I may, which is I've heard that there is an extra dose in some of these vials. I don't believe which manufacturer. I don't remember which manufacturer, but it required a special needle to get that final dose, and it was allowing us to get more doses out of each vial. Mm-hmm. Do you have access to those needles, or is that a resource that you need?
Yes, we do. And we found very early on, and it's the Pfizer vaccine, primarily, that has at least one extra dose in each vial. It's between the skill of the individual drawing up those doses and the needle itself, and we do have access to the needles that we need. So thank you for asking. Good question.
And we were on top of that right away, but that's a great question. Member Ozog, followed by Member Rutledge.
Thank you, Mr. Chairman. Karen, yesterday at the end of the day, I got a phone call from a constituent. She's a caregiver for her adult child, mm-hmm. and she finds out that she is in level 1A, but her child is in 1C under medical, over 18 and under medical disability or situation. So my question for you is, and I can send you an email about this specific issue, but she also indicated that there were different classifications, for instance, in Cook County that she had heard of. Again, I'm not positive about all of these things, but do you have do you have discretion over 1A, B, C and going into the rest of the classifications, or is it coming from the state? Because I'm unclear from what this particular constituent was hearing, that there seems to be some discrepancy in how this is being allocated or classified.
Yeah, we are going by federal and state guidance because of the ability of those organizations to do an in-depth analysis. We don't have that capacity at the local level at this point to do that. There have been individuals who have been added in the 1A category in a way that the communication has not always been effective in reaching local health departments. So is it possible that there are that we have not received information on individuals who may be eligible? It absolutely is. But then there also is nothing with vaccine providers to make independent judgments. We've been working closely with our healthcare systems and have a very good understanding and relationship that they'll vaccinate only people in the eligible categories, but there isn't a whole lot that can be done from a local health department standpoint if people do not abide by that.
But are you absolutely required to follow these, or do you have some discretion within the one agency?
We have some discretion,
Okay.
but by and large, we abide by them.
Okay, but it's not written in stone.
No.
Thank you.
Yes.
Thank you, Chairman. I'll jump right in. I didn't know if I had to send a flare up.
Member Rutledge, followed by Member Schwarzy, please.
Thank you, Chairman Cronin. I have two questions for you, Karen. Thank you, first of all, to you and your staff. I continue to wish a long night's sleep for all of you. My first question is, when you showed the map of all of the vaccine partners in the county, there were very few in District 6. So are you continuing to work on vaccine partners in District 6? And my second question is, can you give us some ideas about new vaccines that are coming? I heard yesterday that one of the companies pulled their vaccine because they did not get the results that they wanted. And I know that Johnson & Johnson is coming soon with a one-shot vaccination. Yes. So if you could give us an update about that.
Yeah, so if you remember, I think there were over 20 vaccines that started out in as we began this journey, and to have 2 already available and so effective is marvelous, but not everybody makes it. So Merck withdrew their interest in going any further for a vaccine. In fact, instead pivoting and really working on the therapeutic side of treatment of COVID-19. Johnson & Johnson, we understand, will be next up from a vaccine approval basis, and we anticipate that vaccine to be available in February.
Great. And my other question was about District 6.
Yes. We continue to reach out to individual providers and recruit individual providers. So if you know of pharmacies or doctors' offices or chains who have not yet gone through or aren't aware of what to do, please send them our way. We'll be happy to work with them. Then if there continues to be gaps in where we can provide the vaccine across the county, that's where we'll take and consider some of our mobile vaccine strategies.
Excellent. Thank you so much, Karen.
Yep.
Member Schwarzy.
Thank you, Chairman. Karen, Group 1B is a rather large group, around I think 250,000 people, and it's very diverse as well. I mean, you could have a 30-year-old healthy person who works at a manufacturing plant in the same group as maybe a 90-year-old senior that lives in a single family home with multiple medical problems. And I get it. Everybody's important. But being that I think you said you had about 141,000 people signed up now, how are those people picked when you're getting 13 or 14,000 doses per week? Is it whoever signed up first? Is it chronologically? Do you guys look at some of the different?
Yeah, great question. It is chronologically. The other factor that I failed to mention is, we've been dealing with individuals who are quite computer savvy and literate prior to the expansion into 1B, and not saying that we don't have some seniors who are extraordinarily computer literate. Many of them choose to use telephone or some more of the traditional communication tools. So we are also expanding and contracting with an external call center. Should be launching that this week to be able to not only address their questions, but also make sure that they're registered.
Karen, if I may, this is Rashmi Chugh. Just wanted to also add that when folks register for their vaccine, there is an opportunity to enter the category or to select the category that fits their role, meaning if they are in healthcare or if they're 65 and older or if they're a frontline essential worker, by sector. So that way we're able to disseminate vaccination appointment availability based on the role that they selected.
Thank you very much. That's all.
Okay, further questions, member Lynn LaPlante.
Thank you so much, Chairman Cronin. And thank you, Karen, for all of your help and hard work. I learn something every single time you give a presentation. My question is about the variants that we're seeing. So, for example, the B117 variant. How are you going to do anything different in terms of adjusting if we see an increase locally in DuPage County of the B117 variant or another variant due to its much more rapid contagiousness?
I don't know that we will do something different based upon a new strain being found or variant found in DuPage County. It will be based upon, our actions will be based upon the impact of that. So what we know is that the variants respond to and will be prevented from spreading if we keep people masked, if we keep people out of crowds, and if we keep people isolating and quarantining appropriately. So it would be more the impact of the spread versus the actual presence of the virus.
Okay, thank you so much.
Okay, further questions for our director, our leader at the health department, Karen Ayala. Further questions? Anyone? I don't see anyone here. Thank you very, very much, Karen Ayala. You are just awesome. Thank you for all the good work you and your team are doing.
Thank you.
We move on to the next portion of Chairman's report. I have a few remarks I'd like to offer, please. It's fair to say that vaccination information is pretty much the number one topic on most folks' minds these days, as I mentioned earlier, and I'm sure I share this experience with you. Everywhere I go, every communication I engage in, I am bombarded with questions, and I know that you are too. As our region has moved into Class 1B, or has been classified into this stage of 1B and then 1C, seniors and more essential workers, I'm sure there's going to be more questions. And people's frustrations and their patience will be even their patience will be in shorter supply, and frustrations will grow. I'm counting on this issue of supply being resolved in the next several weeks. I'm hopeful, and I have high expectations for the new Biden administration. And so please know, as I said earlier, I am advocating aggressively for our county to receive a steady, predictable vaccine supply that it needs to keep our people healthy. I really want to thank our healthcare partners, all the DuPage County hospitals and health systems, especially DuPage Medical Group. They have been they've really stepped up and taken on a lot of responsibility here. Together, we are navigating these operational and logistical difficulties, and our healthcare partners have been marvelous to work with. So thank you very much. I also appreciate the enthusiasm that I encountered, that I experienced when I talked with board members about our diversity and inclusion strategic imperative. Last week, I invited 7 board members to take the next steps in developing a business enterprise program for the county with a specific emphasis on transportation, public works, stormwater, and facilities management. The newly formed ad hoc committee on diversity and inclusion will move this initiative forward and make relevant policy recommendations to the rest of the board. So thank you to all who have agreed to serve, including our co-chairs of this ad hoc committee, Sadia Covert and Amy Chavez. Transportation Director Chris Snyder will also serve in a critically important position as liaison to the committee. the ad hoc committee. So that concludes my remarks. That concludes my report. We move on to the next order of business entitled Public Comment. Public comment. So I'm going to turn to our Deputy Clerk, Mr. Adam Johnson, if you would be kind enough to proceed with public comment. And as I turn it over to Adam, I do like to emphasize that according to our county board rules, which may be revised soon, members of the public shall be afforded time to address the board. Individual remarks shall not exceed 3 minutes in length, nor shall the total time provided for all remarks exceed 30 minutes. So, Mr. Johnson, please proceed.
Thank you, Mr. Chairman. We do have some people here in person for public comment, so I'll start with them. We have a Mark Daniel from Oak Brook Terrace.
Morning, everyone. My name is Mark Daniel. I represent West Suburban Athletic Development Corporation. That is item 10A on the agenda today. Thank you for your attention to this matter. We are going to be asking for a remand of this project to the ZBA, and I'm going to explain to you some of the background so that you're aware of the reason for the remand. Sawmill Garden is proposed as a fully scheduled athletic facility, multi-sport, multi-age group. It is a public recreation use, 80 feet west of Darien as it extends south of Route 50 or Interstate 55 between Cass and Route 83 along the south frontage road of the highway. This project will bring to the county between $13 and $15 million per year in economic revenue, not to us, but to hotels and restaurants. This project is squarely within the 2019 sports tourism plan that the county put together. It is a feature facility. I will note we were criticized at the ZBA for being a private entity trying to cite a feature facility in DuPage County. You have two, a private bowling alley, single sport, and the Kaufman facility that's gone in Westmont that I was involved in when it was trying to locate at Oak Brook Hills Resort. Under the scenario where DuPage County needs feature sports facilities that are open to all, where your club can go rent time, where the county visitors bureau can work to host tournaments that benefit the county, there should be a necessity and an urgency to get something like this reviewed the right way. I understand from the comments at the Development Committee that a lot had changed following the ZBA hearing, and I think you understand from my experience that I think that is what is supposed to happen after a ZBA hearing. But I agree enough has changed. And I will tell you that so much has changed that as of this morning, I can faithfully say this project is one of those that I classify as an as-of-right conditional use. No PUD needed, no variations, no exceptions, no map amendment. This is a proper R2 conditional use as a principal recreation use. I submit to you that in my experience with the Illinois Division of Intercollegiate Athletics down in Champaign, the Governor's Council on Health and Fitness for many years, as a president of a local swim club and someone who has helped put on swim meets, regional swim meets in other cities because we don't have them. Pleasant Prairie, north of Indianapolis. Pleasant Prairie, Wisconsin, north of Indianapolis in Indiana. I've been to Iowa for these meets. We don't have the facilities. Not even Chicago has the facilities to run some of these things. I added a few things to the application, and I think back to the invocation, don't leave us to ourselves for the blink of an eye. But there's a lot in that application that made sense. Roof signs that no one's going to see because, you know what? Visit DuPage.org. Choose DuPage. Welcome to DuPage County. Makes sense. No one can see it. It's on a 25,000 square foot roof. But we did run into a buzzsaw at the ZBA. I think the ZBA in its pandemic processes heard 35 to 40 minutes on a $16 million project where I was speaking. I summarized plans. The plans were not accurately summarized during the deliberations. There were clear mistakes made in assessing the plans, and I think it should go back. We will likely amend the application during the process. But I would ask that you remand it to the ZBA. We are paying very close attention to this. There can be no better thing. As I sit here, I know you sit here, you hear from the Visitors Bureau. Imagine me. I sit through meeting after meeting during every year, the last 25 years, hearing about hotel occupancy rates, whether I'm on the municipal side or the private side. DuPage needs this. Tens of thousands of visitors. This is a good project, so please remand it to the ZBA. I look forward to seeing you in a few weeks, hopefully when it comes back, and we will talk to you then. Thank you for your attention to the pandemic, by the way. I do want to say that.
Next, we have Don Schramm of Willowbrook.
I'm Schramm. I live at 17W350 Shield Drive in Willowbrook. Margot Barrett is my neighbor to the north, and my home is 70 feet from where this development will be going. There is no trend for this type and size of development anywhere in or near our area. In fact, the trend in our unincorporated area has been the Forest Preserve buying land to preserve it. Just outside of our area, the trend has been for small one-story buildings with minimal parking area spaces with business hours of Monday through Friday, 9 to 5 and closed on weekends, and none have been built on a floodway, floodplain, or wetlands. This would be the first 7-story tall building and business of this magnitude in our area, and the very first to be built on a property that is over 60% floodway, floodplain, and wetlands. Reports from the Fire Protection District, the Downers Grove Township Highway Department, and the Forest Preserve District all state that they have numerous concerns and objections to the developer's plans. Even though the developer has made concessions at the last minute for reduction of the dome and removal of the lights, restaurant, bar, and pool, this will still be a high-intensity business. They will only be lowering the dome from 8 stories high to 7. No lights will only reduce hours of outside activity by 2 hours, going from 14 hours of daily noisy soccer games to 12 hours, and will have no bearing on the long hours of indoor operations from early morning until past midnight year-round. The removal of the restaurant, bar, and pool will have no effect It will have no effect on the traffic and the impact to the safety of the community and the public that already use this narrow roadway. There's no guarantee that the plans for controlling and redirecting water flow will work, and the potential of increased flooding is always going to be a possibility. Finally, there is no question that our home values will be greatly diminished. Our privacy, comfort, and ability to enjoy our backyard will be gone forever. No longer will we have the peace and tranquility that the Forest Preserve and the animals provide, and it will be replaced with a busy hub of noisy, whistle-blowing crowds and a never-ending parade of cars and car lights coming and going all day long, every single day of the year. This development is not suitable for this piece of land and is not for the use and enjoyment of our community, and would only serve to impair the public health, safety, comfort, morals, and general welfare of our community, as well as create a major nuisance to all who live here. I'm asking you to please reject this petition and deny the rezoning of this property and all conditional use exceptions. Thank you very so much for your time.
Next, we have Linda Painter of Willowbrook.
Good morning, Chairman and members of the County Board. My name is Linda Painter. I am the Commissioner for the Forest Preserve District of DuPage County, in the district in which the subject property is in. Waterfall Glen Forest Preserve is adjacent to this property on the west side and the south side. Waterfall Glen Forest Preserve is one of the most ecologically impressive parcels of open space in DuPage County. It contains 740 native plant species and more than 600 species of wildlife and insects. Waterfall Glen is home to at least 30 species of endangered or threatened plants and animals. Additionally, the subject property is adjacent to a Class 4 ecosystem, the Forest Preserve's highest rating. The Forest Preserve's objections are listed on pages 568 through 571 of your packet, one of which is 18 inches, not 18 feet of setback, 18 inches. Everybody seems to think that the Forest Preserve doesn't care, but we do, and so do the residents. The fire department's objections, of 12 of them, are listed on page 567. Downers Grove Township's objections are on 572. Downers Grove Township Highway Department's objections are on page 572. I am also the president of Timber Lake Civic Association. Timber Lake is located south and east and northeast of this property. I represent 780 single-family homes in a quiet, residential, unincorporated neighborhood. We've been attending the public hearings for the Zoning Board of Appeals opposing the magnitude of this complex in our neighborhood. We filled the room with 50 people at the Zoning Board meeting, which was the COVID maximum at the time. No one spoke in favor of this project except the petitioner's team. The Zoning Board of Appeals voted to deny this project based on not meeting the 7 standards for rezoning, and it did not meet the 7 standards for conditional use. The vote was 5-1 to deny. That's on 511 of your packet. You have a very long packet. That's why I'm providing the page numbers. The Development Committee denied the proposed soccer complex also 5-1. Our quiet community would become a loud and noisy area 7 days a week with increased traffic. There have been 2 major accidents recently, one of which there was a fatality at the intersection where the traffic will enter and leave. The traffic study that was provided had a number of major flaws. Property values would definitely drop because of this complex. A complex of this magnitude would have a detrimental effect on the Timber Lake neighborhood and the plants and animals of Waterfall Glen Forest Preserve. The petitioners made a last-ditch effort last week to make concessions. None of the concessions changed the standards that they did not meet at the ZBA hearing. So they will not be able to meet the standards today, even with the concessions. Because of so many objections of governmental entities and the ZBA and the Development Committee, we urge you to vote no on this complex. Thank you for your time.
Next, we have Michael McGill.
Morning. Thanks for your time. I want to commend your chair of your health department. She's excellent. So impressed. Congratulations on being such a great person. Anyways, I represent an entity that has a bona fide cash offer to buy the subject property and keep it a horse farm. Second of all, I want to point out, and some of the things Mr. Daniels had presented, I don't believe to be factual or true, because they just built a huge indoor soccer arena about 3/4 of a mile down on the other side of I-55 in DuPage County. So I think it would be overkill to put soccer fields in this place, this lot here. If you haven't been by the lot, you should go by it, because there's wildlife all over the place and it's surrounded by a forest preserve. And there's really not a great road there for all this traffic that's going to come with this. And to put something into that location when you got the same thing less than a mile down the road doesn't really make sense. Like I said, it's not factual that DuPage doesn't have anything like this, because it's not true. So it's called Compass Arena. You can see it as you're going along the highway, big 3-story building with more than a couple soccer fields in it. So the fact that Mr. Daniels says there's nothing like this in DuPage, it's not true. There's plenty of other vacant lots where if they wanted to build or do something like this, they could acquire. DuPage County is a large area. So, that's all. Thank you for your time.
That's all the in-person public comment we have. We did have a large number of online submissions, so I'm going to begin reading those into the record as well. First comment is from a Christina Shapak. Oh, Mr. Chairman?
I'm sorry, forgive me. What did you make note of the time in any event, Mr. Deputy Clerk? Just, I think we started public comment about 10 minutes ago.
I had public comment down as starting at 11:20 a.m.
Okay, very good. Thank you.
So the first online submission is by Christina Shapak of Elmhurst. The subject is lunches outside. Comment is, this is totally unacceptable for kids to eat outside in winter for 30 minutes. My kid came back home with full lunchbox because she said it was too cold to eat. School is such a big building and all grade levels having lunches in different times. Therefore, we can't not find room for kids to eat inside. We pay so much taxes for this board to sit and decide all these ridiculous measures that do not make any sense whatsoever. Next comment is from Joan Park of Naperville. The subject is in-person school. The comment is plan for all kids to go back ASAP, 5 days a week, enough. Next comment is from Bill Shuey of Wheaton. Subject is COVID vaccinations. Comment is DuPage County is moving far too slowly at giving immunizations to its residents. Friends and family in Florida, Michigan, and Arizona who are in Group 1B have either gotten their first shot or have an appointment to receive it. According to the New York Times, Illinois has only used 30% of its supply of vaccine. The DCHD website states that it will take 8 weeks to give all of the 1A shots. This is far too long. This is an emergency. Act like it. It should be all hands on deck, not business as usual, and we will squeeze the shots in. Use every doctor, dentist, nurse, pharmacist, and every other person who can give a shot. Suspend normal operations except for emergencies. Hospitals could give shots 24 hours a day. People would get up in the night for an appointment for a shot. DuPage County is failing in its responsibility to its citizens. This comment is from Natalie Escamilla of Elmhurst. The subject is Elmhurst Schools Hybrid Plan. Comment, I am sending the same comment that I sent to the D205 Board of Education in the hopes that it will facilitate change. Currently, our children are given only one 35-minute break during the day, which lasts from 8:15 to 1:15. They're only allowed to eat and drink if they are outside, which is nearly impossible when they are sitting in freezing weather. I'm wondering why and who made the decision for our children to only be allowed to eat outside. Additionally, why are they only given 35 minutes of break time during the day? In regards to snacks and lunch, research tells us that our kids need to eat during the day to be successful and to learn. There are many articles, papers, dissertations, etc. that detail the importance of food during the school day. According to the National Education Association, food is a need, not a want, and if we want kids to be able to concentrate and grow and be healthy and happy, we must see to it that they are fed. Our children are now being told to eat in freezing weather. It was 13 degrees when my son went outside yesterday, and he said he couldn't feel his fingers. How is it that schools across the country are allowing kids to eat? How is it that Mary Queen, one parking lot across the street from Emerson, is allowing kids to eat inside? How is it that every private school is doing the same and has done so successfully all year long? Whoever passed this mandate is doing a terrible disservice to our children. It's not fair, it makes no sense, and it completely contradicts what pediatricians recommend. This has to change. Why are we not spacing the kids out and rotating time in libraries, multi-purpose rooms, gyms, and cafeterias? My sister is a principal in another school, and that is what they are doing. Why has that not been an option? In regards to breaks, one 35-minute break is not enough. Again, study after study say that kids need breaks and recess. Rebecca A. London, an associate professor of sociology at the University of California, Santa Cruz, and William Massey, an assistant professor in the College of Public Health and Human Sciences at Oregon State University, wrote an article in EdSource and stated, recess is where children exercise their bodies and practice their social and emotional skills. Negotiating who goes first in tetherball, resolving whether the ball is in or out in soccer, coping with sadness or anger after losing in Foursquare, and learning to be empathetic when a friend is sad all contribute to students' positive development. These peer connections through play contribute to student healing. They conclude, when schools reopen, recess and other play-based break times must be incorporated into the learning environment. Social support and physical activity help buffer children's stress response, which will be needed. This is the opposite of what we're doing for our children, and it's not right. I've asked in multiple school board meetings, and I'm asking again, please consider giving our kids more breaks during the day. Their mental, social, emotional, and education states need it. Lastly, if we do not give our kids more breaks, why are we not sending A segments from to school in the morning and B groups in the afternoon? Studies now show that the virus does not sit on surfaces, and again, that schools are not super spreaders. Our kids need to be in school. This would allow for some normalcy at least half the day. Please consider alternative options to what is occurring today. Next comment is from Michael J. Fatino of Elmhurst. The subject is the health department must change their return to school framework now. Good evening. I know you've addressed this previously, but it feels like you're passing the buck. You do not have the authority to advocate you do have the authority to advocate for the children of DuPage County. You can encourage the health department to review their guidelines to be sure they are up to date with the latest guidance from CDC. The return to school framework is being used as a crutch, a poor excuse to keep kids locked out of school. The health department must ensure that their return to school framework espouses the latest guidance. Chicago's health department has updated their guidance. Any further excuse-making, backpedaling, or passing the buck only serves to penalize the children of DuPage County. They're being deprived of the education they have a right to and deserve. With updated guidelines, no one can use this framework as an excuse. Do it before we have a tragedy in our communities. Thank you. Next comment is from Kim Belize of Elmhurst, subject return to school. And comment is, what does it take? What more can we do? How are states around us wide open and our children in Elmhurst, Illinois continue to suffer? Isolated, depressed, stuck in their bedrooms or wherever their Chromebook is stationed for remote learning. Sad, feeling defeated, missing out on education, missing peers, missing a classroom filled with laughter, encouragement, activities, guidance. Sports are still questionable, sadly. Hybrid is a joke, remote learning is offensive, our cases are down, deaths are at an extreme low. Science has spoken that children in schools are not super spreaders. Infectious disease specialists, medical doctors, and psychologists have come together to defend our children. The risk of them not being in school highly outweighs anyone's benefit if there even is one. It's time for DuPage to stand up for our children and get our children back in school. We are depending on you as our children are depending on us to be their voices. Next comment is from Ann Rockwell of Elmhurst. The subject is, we need your help in D205. The comment is, D205 needs your help. Our children's futures, educations, and mental states are being jeopardized because our BOA and teachers union are at odds. The elementary kids are sitting outside on the ground in 24-degree weather for 30 minutes because they will not allow them to eat at their desks 6 feet apart without masks on, despite the CDC's recommendation that it should be allowed. This is one example of the lack of common sense our board has shown. Why do they think they know better than the CDC? These kids need to be in school. Many other states with higher numbers and private schools are doing so with great success. Why are we not following their lead? I'm begging you to address our board. Please consider direction and metrics for each school district. Please consider the health and well-being of these students and families. Do we need more tragic events to unfold before something is done? Next comment is from Kathy Nash of Lombard. The subject is Sheriff Mendrick public comments. Comment is, as a law-abiding, tax-paying resident of DuPage County, I was appalled to see Sheriff Mendrick's public comments across social media in response to the passage of a criminal justice reform bill by the Illinois State Legislature. He began his fear-stoking comment by stating, I'm very sorry to announce the dismantling of public safety as we know it. He then goes on to present half-truths about the bill. He likes several incendiary responses, such as, post their names all over and post what they voted on to defund our men and women. We need to take our state and country back. As we learned all too clearly, stoking public fear is dangerous. Does Sheriff Mendrick hope to incite violence against our elected politicians because they voted for a bill he disagrees with? Some of the responses to Sheriff Mendrick's comments certainly think that is the answer. Do we want to see what happened in Washington happen here in our own community? Because this type of irresponsible rhetoric can lead to violence, I hope the DuPage County Board considers censuring Sheriff Mendrick. Next comment from a concerned citizen. Subject, Sheriff Mendrick's Facebook commentary. Sheriff James Mendrick ran on a promise of public safety, not politics, with a promise to remain neutral and serve and protect. His recent social media comments on his Facebook page regarding the passage of HB 3653 are a direct violation of this promise. Shame on Sheriff Mendrick for adding fuel to the flames of our already smoldering democracy. Next comment is from Edgar Powell. The subject is public comment for ad hoc committee to review county board rules. Comment, I am very glad to learn that Chairman Cronin has appointed an ad hoc committee to review the county board rules. I read the organizational review packet posted online, and I see that the committee is looking at public comment rules from the other collar counties. I hope that the committee is planning to continue to accept public comment in the same way as it does today. As a resident who works a full-time job, I am unable to travel to the county administration building to attend meetings in person, and this was especially true before the COVID-19 pandemic began. I appreciate that there's an option to submit public comments via the online form so that they may still be read aloud during the meeting as if I'm attending in person. This also allows the board to hear the perspective of a wide variety of constituents who might not otherwise be able to attend meetings in person. Additionally, I hope that the committee will look into other ways to maximize public participation. For example, the committee could ensure that all meetings will continue to be video recorded and posted online. Alternatively, the committee could schedule certain meetings to take place in the evening when more residents are likely to be able to attend in person. Of course, in-person attendance will be feasible only once the pandemic is over, but now would be a great opportunity to think ahead and enact rules that can last a long time. Next comment is from Michael Ockram of Willowbrook. The subject is please vote no on soccer complex. Comment is, county board members, I respectfully request that the county board vote no on the proposed soccer complex on the frontage road in Darien. Thank you for your consideration, Michael Ockram. This Next comment is from Beverly George of Naperville. Subject is proposal to request Governor Pritzker to veto HB 3653. Comment is Chairman Cronin and DuPage County Board members. It has come to my attention that the County Board meeting agenda on January 26, 2021 will include a proposed resolution to have board members approve a letter to Governor J.B. Pritzker urging him to veto HB 3653 when it comes to his desk for signature. I also understand that the resolution is based on the argument that sufficient time was not taken to hear from the public and from city governments across Illinois before it was passed. However, the bill has been open to public review since September 1st, 2020, and 9 public hearings followed with over 30 hours of public comments. I've read several articles on HB 3653 from the Chicago Tribune, the Chicago Sun-Times, and NBC News, and I ask all of you to vote no on this proposal seeking the governor's veto on HB 3653. I've also read several points presented by State Senator Andy Manar. My reasons follow here. 1, the bill contains many strong components for sound criminal justice reform that are long overdue and that I would like to see implemented in Illinois. The bill seeks to remove previous inequities in the system based on race and/or income. 2, at the same time, the bill supports victims of crimes by expanding meaningful portions of the Crime Victims Compensation Act. 3, collective bargaining rights are protected in the bill for Illinois police officers. 4, components of the bill that address eliminating bail, a major source of concern to many readers, will not be initiated for almost 2 years, and in the meantime there should be time and plans to study and test cases how it will be applied and the outcomes. The cases of serious crime where victims would feel threatened if the accused were not held in custody nor monitored by electronic surveillance would still fall within the judge's discretionary power to impose such conditions on the accused after the arguments for them have been presented. The links to the articles are below. I believe they provide sufficient information to ask that Chairman Cronin and the County Board members vote no to the proposed resolution. There are then links to websites from NBCChicago.com, thechicagotribune.com, and chicagosuntimes.com. And this says, thank you, Beverly George. Next comment is from Vincent Winkus of Willowbrook. The subject is reasons to deny the proposal for soccer complex in Timberlake. Comment 1, South Frontage Road between Cass Avenue and the proposed soccer complex is a 5-ton rated frontage road that will be shared by the Darien Public Works Department, a 20-plus dock door trucking warehouse, Argonne National Laboratory, I-55 entrance and exit ramps, residents of Timberlake, area school buses, and bicycle riding clubs. 2, at the intersection of South Frontage Road at Cass Avenue, there is a sharp turn with a short radius that cannot be negotiated by truck traffic without using all lanes. This would constitute a very dangerous situation if there were added traffic from the soccer operation. 3, South Frontage Road is not an engineered major thoroughfare designed to support the volume of traffic which this operation will generate. It does not have sidewalks, curbs, gutters, sewers, or lighting. It would be incredibly dangerous for any person or child to access the facility on foot or bicycle. 4, the intersection of South Frontage Road and Cass Avenue is extremely close to the exit and entrance ramps from I-55, Argonne National Laboratory, Waterfall Glen Forest Preserve parking, and 91st Street. One traffic light is not going to solve the complexity of traffic flow at this location. 5, when traffic backs up going west on South Frontage from the proposed soccer complex, the traffic will then go east, regardless of proposed signage, without police intervention through our Timberlake community, which is an unincorporated residential community with no sidewalks or street lighting, creating a very dangerous situation. 6, reducing the proposed height of the dome to 65 feet and retaining the R2 single-family residential zoning still puts the dome 30 feet above the residential maximum height. 7, noise from the operation of the soccer complex would emanate into our neighborhood houses and backyards. 8, the proposed soccer complex would be between forest preserve land and disrupt established migratory routes used by area wildlife, including deer, coyote, fox. Please record my opposition to the proposal to locate the sports and entertainment complex on South Frontage Road in the Timberlake community in unincorporated DuPage County. I agree with the decision by the DuPage County Zoning Board to deny this proposal with a vote of 5-1, and by the DuPage Development Committee to deny this proposal with a vote of 5-1. Thank you. Next comment is from Kim Lewin of Willowbrook. Subject, vote no on the proposal for soccer complex from a Timberlake resident. Comment is, please record my opposition to the proposal to locate the sports and entertainment complex on South Frontage Road in the Timberlake community in unincorporated DuPage County. I agree with the decision by the DuPage County Zoning Board and the DuPage Development Committee to deny this proposal with a vote of 5-1. This is not an appropriate location for a business with a large number of patrons. The complex is detrimental to the forest preserve land surrounding it. It will be a nuisance to the residents of our community and to value our property. Frontage Road was not designed to support the amount of traffic that an entertainment sports facility will attract. This will create hazards for the people of Timberlake, the semis from the truck warehouse, school buses, and the many bicyclists who ride on this road. Next comment is from Waylon and Marlene Lewin of Willowbrook. Subject, opposed soccer complex being built in Timberlake community. Comment, we oppose the petition for the soccer complex, which will disrupt our community, lower our property values, and create traffic safety hazards in our area and on South Frontage Road. Please record our opposition in your record. We agree with the 5-1 vote denying this petition by the DuPage County Zoning Board on December 3rd, 2020, and the 5-1 vote denying this petition by the DuPage County Development Committee on January 19th, 2021. Next comment is from Sarah Reynolds of Naperville, subject HB 3653 police reform. Comment, please vote no to the resolution asking Pritzker to veto on HB 3653. We need to restore trust in our police department and have more transparency. Body cameras benefit everyone. I believe HB 3653 has helpful provisions and is a good bill that will help our community. Next comment is from Tom Tooney of Wheaton, subject HB 3653 police reform. Comment, reject any move to request Governor Pritzker veto police reform. Regards, Tom Tooney. Next comment from Beth Carter of Naperville, subject resolution to encourage Governor Pritzker to veto the crime bill. Comment, I do not support this resolution. This crime bill has the support of the Naperville Chief of Police, and I encourage Governor Pritzker to sign this bill. Next comment is from K. Wyatt Merritt of Glen Ellen, subject HB 3653. Comment, I urge board members to vote no on the resolution that would ask Governor Pritzker to veto HB 3653. Illinois should strive to be in the vanguard of criminal justice reform in this country. Please do not act progressively and reflexively on this issue. This comment from Sarah Novi of Lombard. Subject, resolution recommending Governor Pritzker veto HB 3653. Comment, I am disappointed that Republican members of this board are putting forward a resolution against HB 3653. After George Floyd was murdered by police in Minneapolis, a groundswell of national activism demanded accountability by police to the citizens that they are charged with protecting. This bill provides many of those demands, including banning the use of chokeholds, requiring the reporting of deaths in police custody, and expanding police training and use of force and crisis intervention. All of these are good things. If there's a specific provision the board disagree with, they state clearly what it is. Otherwise, passing a resolution against HB 3653 is a vote against police accountability and transparency. As a citizen of DuPage County, I demand accountability and transparency from my government, and this includes the police. Next comment is from Julie Mark of Lombard. Subject, don't ask Pritzker to veto HB 3653. Comment, please vote no to this proposed resolution seeking the governor's veto on HB 3653. This comment is from Robert Seville of Naperville, subject HB 3653. Comment, please encourage the governor to sign HB 3653. Our criminal justice system needs reform. I don't want to see police murdering people on TV anymore. Next comment is from Sarah Lukes of Warrenville, subject HB 3653. Comment, I do not want the governor to veto HB 3653. After all the race-related policing issues that led to last summer's BLM protests, it is time to admit that the current policing system needs some rework. HB 3653 will increase police accountability by enacting new police training policies, requiring body camera, reforming crowd control, and changing sentencing laws. I know that these issues seem far removed for most residents of DuPage. We are 66.3% white, and we are the 16th wealthiest county out of 3,006 in the U.S. As a white citizen, I am not afraid that I might be injured or killed during an interaction with a police officer, but it is a different experience for people of color. I know that the vast majority of police officers are good people who are trying their best to do a difficult and dangerous job, but it's clear that there are bad apples in the system. These officers need to be retrained and held accountable their actions via body cameras. Why would anyone not want that? The good officers would benefit from this, as it will help to improve the public's view of the police in general. Next comment is from Janice and Walter Podolsky of Naperville. Subject, opposed resolution asking Gov to veto HB 3653. Comment, HB 3653, the Criminal Justice Reform Bill, would bring much needed reform to current policing and judicial practices. It would end cash bail, require police wear body cameras, increasingly the only evidence in recent shooting crimes that can substantiate or refute testimony by police or suspects. Revise and improve police training and accountability. It has long overdue justice reforms. Ask Governor Pritzker to sign HB 3653 into law, not to veto it. Thank you, Janice and Walter Podolsky, Naperville. Next comment is from James Woznicki of Willowbrook, subject soccer complex. We live in a quiet, family-oriented section of the world. We don't need an additional burden on our traffic or noise level. I-55 and Route 83 are busy enough without this additional traffic. We'd like to retain our quiet, peaceful neighborhood. Please vote no on the soccer complex. Next comment is from Evangeline Killar of Naperville. Subject, letters of protest do not constitute county business. Comment, I'm alarmed as a taxpayer and avid local election voter that a proposal to write a letter in protest of HB 3653 from the DuPage County Board is even being considered a board meeting agenda item. This is a waste of your time as a board, which equates to a waste of our tax dollars paying your salaries. Disapproval of HB 3653 is a partisan issue, and protest letters should be mailed by individuals. How dare you pretend to represent the feelings of an entire county in this way? Stick to what you've been hired to do. This partisan act isn't a county board duty. Disgusting that I even need to shame you all in this way. I will be remembering your names in the hopes to vote you out in the future. Please take your job more seriously in the future and get back to work. Next comment is from Bonnie Garris of Wheaton, subject HB 3653, Criminal Justice Reform Bill. Comment, I do not want Governor Pritzker to veto this bill. I'm in favor of HB 3653. It eliminates monetary bail, requires all police officers to wear body cameras by 2025, and bans police departments from purchasing military equipment like 50 caliber rifles and tanks, according to a report by NBC5. Next comment is by Eliz Albert of Wheaton, subject Bill 3653. Comment, I support no cash bail and police reform. I strongly believe in body cameras for officers. Black Lives Matter. I do not support the sheriff's comments on his campaign page and his personal Facebook page. Such comments are so unprofessional. Next comment is from Laura Howell of Warrenville, subject HB 3653, Criminal Justice Reform Bill. Comment, I'm a DuPage County resident in the 6th County Board District. I support and appreciate the Criminal Justice Reform Bill, necessary and overdue act to reform policing. Changes are meant to make it easier for the state to intervene and disqualify officers who tarnish the profession, breed public mistrust, and even endanger the public while providing officers with due process protections. Prior to this, it was very difficult to hold officers accountable. I support this bill, which was developed over several years, and those using scare tactics should not result in premature action by this board to reject it out of hand. Next comment is from Stephen Davis of Downers Grove, subject resolution CBR 0099-21. Comment, please remove this from the agenda. A vote by the board does not necessarily reflect the will of the voters in DuPage County. Next comment is from Edgar Powell. The subject is committee chairs. Comment, I would like to congratulate, albeit belatedly, the new county board members who assumed their seats last month. I would also like to congratulate member Selman for becoming vice chair. She has been an accomplished and sensible leader on the county board. Additionally, I would like to congratulate those board members who received their committee chairmanships, including member Chaplin, who is now chairing the finance committee. She's been a tireless advocate for good government, and I'm sure she'll do a great job. Having said that, I'm puzzled by the distribution of committee chairs. For example, among the 7 Republicans, only 4 were given chairs. We already know why member DeCiani no longer holds a chair, but surely the board could have found something for members Hart and Eckhoff to do. Member Eckhoff has been involved in his community for several decades, and member Hart is an accomplished business consultant who earned an MBA from one of the top-ranked universities in the country. Yet this board doesn't value their experience. Chairman Cronin, in one of his private text messages, has already expressed concern about the need for his party's colleagues to stick together amidst this massive shift in power. He also appeared to suggest that the Democrats have displayed favoritism towards certain Republican members. This is quite concerning to me. Among the Democrats, I'm glad to see member Selman get the chair for technology, as she has been a strong advocate for better technology solutions that connect county government to the public. I'm also glad to see member Renahan finally earn her chair on Health and Human Services. I'm sure she'll do a great job, and she's quite capable. However, I also see that she's the chair of JPS, and I can't help but be concerned about her workload for 2 very critical committees with high workload. But again, how did the board pick who gets 2 chairs and who doesn't? Members Covert and Dessart are experienced board members who have been valuable resources to their constituents, yet they get only 1 chair each for committees that do not meet very frequently. On the other hand, member Ozog gets 2 chairs, but I don't see how she's going to be able to handle both. Not that long ago, she submitted a timesheet to the ad hoc committee on county board size, reporting that she had capacity to work only 8.8 hours a week, which was well below the data points submitted by other board members. Clearly, she is busy with other commitments and could use some help. Democrats have gained a lot of power in DuPage, and I'm very eager to see what they do with their new majority. But the voters have chosen a divided government, not a divisive government, and I hope that all board members will continue to work in a cooperative fashion, both within their parties and across the aisle. Next comment is from Tanya Messing of Lombard. Subject, please vote no on resolution to veto criminal justice bill. Please vote no on the resolution to direct Governor Pritzker to veto the criminal justice reform bill. The content and intent of the resolution is at best disingenuous and an attempt by the sponsoring board members to advance their own personal, political, and partisan agendas at the expense of deepening political divides in our community. The bill was passed after over 30 hours of public hearing, during which time many of the concerns of law enforcement and the public were taken into account. Furthermore, the resolution before the board attacks the procedure, not the contents of the bill. If the board members would like a different procedure undertaken by the General Assembly, they should address that directly and not attack a single bill. Next comment is by Deborah Sandstrom of Elmhurst. Subject, false and inappropriate resolution. Comment, good morning. I would like to object to the DuPage County Board making a political and false statement by including and voting on its proposed resolution recommending Governor Pritzker veto HB 3653. Politics does not belong in the board floor, neither do untruths. The following statement taken from the proposed resolution is false. Whereas the first version of the bill, which is over 600 pages, was introduced approximately 2 weeks ago without meaningful input or support from statewide police, county, and municipal organizations. This statement is erroneous. It is intended to stir up political argument. It is false. The county board should stick to county business. It should also stick to facts. Next comment is from Linda Lunt of Elmhurst. Subject, resolution that Pritzker veto HB 3653. I'm very disappointed that members of the county board want to encourage our governor to veto HB 3653. This is not the will of the people of DuPage County. The resolution states that there was no meaningful input from various groups and implies there's only a 2-week notice of the bill. The bill had over 30 hours of hearings and included negotiations with law enforcement groups and the Illinois court system. After it was formally introduced, more negotiations resulted in the removal of the qualified immunity portion of the bill. Police certification, mandatory minimum sentences, drug laws, collective bargaining, and transparency issues were all debated with input from relevant stakeholders months before the bill was introduced. The resolution implies that elimination of cash bail will hurt public safety when in actuality cash bail hurts those who can't afford to pay, keeping them in jail even for minor crimes. What this bill does is modernize sentencing laws, amplify law enforcement training standards, reform crowd control response, and increase and improve de-escalation and mental health training for law enforcement. For these and many other reasons, I would ask the board vote no on this resolution. I'm going to take a drink of water.
Just curious, Mr. Deputy Clerk, how many more comments are there?
Many, many more.
Okay.
Probably.
Do you have any thought about how you're going to proceed? I defer to you here.
I'm under the impression that I will continue reading until directed otherwise by the board. So if the board would like to.
Just for the record, our rules provide that, the totality of all remarks shall not exceed 30 minutes. In the past, we have gone beyond the 30 minutes as a courtesy, as a demonstration of our willingness to listen to members of the public express their views. So we'll continue. That's my sentiment, unless the will of the majority is something different here. But at some point, if somebody wants to entertain some sort of closure activity or action, I would certainly be receptive to that. I see Member Ozog seeking recognition. I guess I should not have opened my mouth. Please proceed, Member Ozog.
Mr. Chairman, with all due respect to our constituents who we definitely want to hear from, our rules do call for 30 minutes. And I think this definitely needs to be an issue that's addressed by our Rules Committee, which is now meeting. And I think going forward, one of the suggestions I would make is that we continue to have online receiving our constituents' comments online. That being said, I think I'd like to make a motion that we follow our rules and that we go to, we discontinue discussion of our public participation now because we've gone past 30 minutes. And in going forward, I would like us to receive a PDF of some fashion of all of the comments that are received both in person and online. But for right now, I'd like to move that we stay with our rules for 30 minutes. And
okay. So Member Ozog has made a motion here. Is there a second? Do I see a second?
Second by Schwarzy.
Schwarzy, okay, there he is, Mr. Schwarzy. Okay, good. Thank you. All right, is there any discussion on this motion, or do we want to go right to a roll call? I see Member Pachowski and Member DeCiani seeking recognition. Why don't we start with Member and Member Covert. Member Covert had her hand up first. I'm sorry. Please proceed, Member Covert.
Oh, no, I just wanted to say that I don't know how we're going to move forward with this. We have to finalize some sort of rules for public comment. But for today, I'm going to have to vote against this because I just want to be consistent. We have always exceeded the 30-minute time before, so I don't want to do something that's inconsistent with my past vote. So I will continue to hear public comments. I know it's long, but the people have the right to speak, and I want to hear all their comments, and I just can't go against, I can't be inconsistent with what I said before. So I'm going to be voting no. Thanks.
Okay, so we have Member Pachowski, followed by Member DeCiani, followed by Member Hart, and then Member Ozog for a second time. Please proceed.
Thank you, Chairman. We've come across this before, and my thought was, if we have people saying the same thing, can't we just read their names into the record and saying we have 35 emails that say, please do not veto 3653, so that at least we know what the category is and who that person is. And if not, then I would say listen to all of them, but we could start categorizing these and lumping them in rather than reading the same text or email time after time after time. Let's lump them in the categories, read their name, and that might expedite things. Thank you.
Let me just offer this quick thought just to help frame it, if I may, please, and we have to go to Member DeCiani. Let's just, for a little perspective, let's remember how this came about. Because of the pandemic and the rules and the guidelines from public health, that we didn't want to entertain a large group of public commenters in our boardroom, we offered this opportunity, this avenue for the public to share their views and concerns through online commentary. Now, over the course of the time, the online commentary has gotten rather voluminous, and not that we're opposed to it, but the process here with our board meeting isn't really completely appropriate to accommodate large numbers of messages. And so just, all of these comments will certainly be included in our minutes. All of these comments will certainly be part of the public record. The question is whether or not we go through this process of reading each and every one. I mean, if there's 1,000 people that comment on it, I mean, at some point we're going to have to draw the line. We're going to be here, for days on end. So it's really sort of a procedural question. It's not intended to squelch anybody's First Amendment rights or any, effort to comply with Open Meetings Act. And so those are my thoughts with that. I'll recognize Member DeCiani.
Thank you, Chairman. I concur with Member Pachowski. I think having a maximum of 30 minutes is more than adequate. We've heard from the people that have come in person, which I think is the most important thing, and the emails, which can often come from out of county and out of we don't require documentation on our emails. So I think do a summary, let them know how many proponents, how many opponents we have, and let's put it in the record. But to read every single one is kind of redundant and kind of, in my opinion, it's going to push the time of these meetings very, very long and not very productive. So, I mean, there are 20,000 opponents to the original bill on this issue that we're talking about. Do you think those were all read into the record down in Springfield? So let's put that in perspective. 20,000 opponents for this legislation before they changed the bill number at 3:00 in the morning. So at the end of the day, we need to be productive, and we can file this in the record, do a summary, and keep it at 30 minutes, which is really our rules. So thank you.
Member Desart.
Thank you, Chairman. One thing that I wanted to maybe add to the conversation is that to make these comments more efficient, and I do like to hear what our constituents have to say, but I'd like us to keep it to 3 minutes. That's our rule, 3 minutes. And I note that the first speaker spoke for 4 minutes and 42 seconds. I have spoken before the Naperville City Council, and at 3 minutes, they cut off the mic. You're done at 3 minutes. And so I was wishing that we would keep to our 3 minute per speaker rule. Thank you.
Member Hart, followed by, I see Member Ozog. I'd like to recognize others if they are speaking for a first time, but as it is now, Member Hart, followed by Member Ozog.
Thank you, Mr. Chairman. Just briefly, I fully agree with the sentiments that Member DeCiani, Member Pacholski raised. I do think for today, just to follow precedent, I would support what Member Covert laid out, which is to continue to read the public comment. I know just from the development issue alone affecting Willowbrook, there were a number of individuals that would have come today had it not been for the snowstorm. So I fully support the Rules Committee on which I sit looking into this, and I think we do need to have some standards to ensure that we're not droning on in our meeting, beyond a certain amount of time. But in this case, I would support reading the comments. Thank you.
Member Ozog.
Thank you, Mr. Chairman. I'd like to also point out that constituents are able to reach us through email. We have phone numbers, either personal or the county, and also social media about these issues. And we do have a 30-minute rule on our books right now. I'm happy to have it discussed by the other, by the committee, the now meeting News Rules Committee, but our public participation has changed significantly because of allowing online public participation, which we did not do my first 2 years on the board. So in terms of adapting to what we have going on here with COVID, we do have a rule on the books. So I've made a motion, and it's been seconded, that we have received 30 minutes of public comment, that we will be forwarded all of the public comment, either in email, obviously, and that it will become part of the permanent record. And I would like to call the question and have my motion.
Okay. There's a motion and a second. Mr. Deputy Clerk, please call the roll.
Wait a minute.
Forgive me. I'm sorry.
Wait a minute. I just didn't know we can just automatically call question. I mean, I agree with what's been said, but I thought this was discussion. I didn't know Member Ozog was doing a closing on her motion. I mean, the issue I have is I agree with you, but for today, should we not take a recess and have the clerk or somebody sort those so we know who the proponents were and not? How do we change it today? I agree if we're going to get emails of the public comment prior to the board meeting so we can look through them, how do we do that today? If there's there's more emails there, how do we not know what people said after we are voting on several issues today they could be sending us public comment on? So to cut it off today, I would ask at least that we take a recess or somebody tell us what the breakdown was for, like Member Bachowski and Member DeCiani said, pro and for Willowbrook or not for Willowbrook, for the veto or not for the veto, so we know that prior to voting on those issues.
Okay, apparently there's need for further discussion. Member Bachowski.
Can I have clarification from the state's attorney? Because when you call the question, doesn't there have to be a 60% majority agreeing to call the question and terminate the discussion on the motion?
To a call of the question, I just observed all the county board members on my computer screen, and there was no one else seeking recognition at that moment in time, and there was a motion and a second on the floor. So forgive me if you guys want to pursue this further with further discussion. If there's a motion
Chairman,
here,
there are some of us in the county boardroom here who have our hands up as well.
Pardon me?
To be recognized.
Mr. McCarthy, please proceed.
I'm sorry, Member Tornatore was seeking recognition and it talked over what you asked me. Could I ask you to repeat that for me again?
It's hard for me to see who's in the county boardroom. Forgive me, please. They have a big picture, and I can't even make out any individuals in the room, frankly.
There's only four of us.
Okay. 4 strong and proud people. So no, it's all good, Sam. Please proceed with your comment or question. I'm sorry I failed to see you and recognize you.
Mr. Chairman, I agree with Member Ozag, although I think that if we want to continue to have discussion, we ought to be able to do that. And if we have a rule on the books, it's 30 minutes. And this is a typical no good deed goes unpunished situation. While in the past we've allowed to exceed 30 minutes, I don't think it necessarily sets a precedent. However, I'll sit here till 7 o'clock tonight if we want to hear from our constituents. But all I would ask for those people who want to listen to our public comment, particularly as it relates to the bill and the resolution, is that we have the same full and fair discussion on that resolution that we're hearing on the public comment. If we're going to sit here for 2 hours and listen to people talk about this bill and our resolution to ask the governor to veto it, or at least some of us, then I think we ought to have as much time as necessary to have that discussion on this very important topic when it comes up on our agenda. Thank you, Mr. Chairman.
Fair enough. Who else is seeking recognition here? Member Renahan.
Thank you, Mr. Chairman.
I think it's difficult because we've almost laid out two different things. We have 30 minutes in our rules, but then, you know, it doesn't matter since the executive order came down. We've kind of been allowing comment after comment, which I think is very important. So how do we change midstream? I don't know. I would ask this rules committee, can we at least come up with a temporary rule for next time? Because, you know, on the fly to try to change things, it just doesn't feel right. But I mean, if we can get some kind of guidance and make a rule, then let's do that.
Well, we have a rule right now, and it's limited to 30 minutes, and we have a motion and a second to impose that rule. Any other discussion? Any other discussion? So Member Desark.
I just want to let you all know, because I know you're so excited to get to the legislative committee meeting at 1 o'clock and afraid that this might go too long, that our speakers are on hold so our meeting will happen later. So we can go as long on this meeting as we need to, that we'll be fine at the legislative committee. Thank you.
Okay. All right. So I do not see anyone else seeking recognition right now. There is a motion and a second before the body right now. So the next step is I call on the deputy clerk to call the roll. There's been a motion by Member Ozog, seconded by Member Schwarzy. Now, Member DeCiani for further discussion.
Just a point of clarification. So this vote with the proposed motion and second would end public comment at the 30 minutes. I just want to make sure that that's correct.
Well, so now that's not exactly fully informative. It will end the reading of these comments into the record right now during our live board meeting, but every single one of those comments will be included in the public record, will be part of the minutes of our meeting. They will be afforded the opportunity to express their First Amendment rights, and we will be complying with Open Meetings Act. So we are voting to adhere to the rules that we have been operating under for some time, although we acknowledge that from time to time we have provided a little latitude. We've provided latitude here today. So, you know, there's a motion and a second on the floor. I suggest that we go to the roll call and then we can be informed by that. Does that sound okay, Member DeCiani?
Good.
Okay. So there's been a motion by Member Ozog, seconded by Member Schwarzy. Mr. Deputy Clerk, please call the roll.
Ozog.
I don't know what she's doing.
You're on mute, Member Ozog.
I'm sorry. Yes.
Pachowski.
No.
Renahan.
No.
Rutledge.
Yes.
Schwarzy.
Yes.
Selman.
Yes.
Tornatori. Zay.
No.
Chaplin.
No.
Chavez.
Aye.
Covert.
No.
Desart.
Nay.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart.
No.
Krajewski.
No.
LaPlante.
Aye.
I show 9 voting aye, 8 voting nay.
So the motion to close the reading of the online commentary is adopted, and so therefore we will move on to the next order of business, and that next order of business is entitled consent. Is there a motion?
So moved, Selman.
There's a motion by Member Selman. Is there a second? Please speak up.
Ridge, second.
Second, Chavez.
Okay, so it's been moved by Member Covert, seconded by Chavez on consent. Mr. Clerk, please call the roll.
Selman.
Aye.
Tornatori. Zay.
Aye.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart.
Aye.
Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
Pachowski.
Aye.
Renahan.
Aye.
Rutledge.
Aye.
And Schwarzy.
Aye.
Okay, thank you, Mr. Deputy Clerk. We move on to the next order of business entitled County Board. Member Ashley Salmon.
Thank you, Mr. Chairman. For the first item, item A, I will yield the floor to Member Zay.
Thank you, Member Selman. Mr. Chairman, I move CBR 9921, a resolution recommending Governor Pritzker to veto House Bill 3653.
Okay, there's been a motion. Is there a second?
Second, DeCiani.
Second, Tornatore.
And so we got a tie for second, DeCiani and Tornatore. There's been a motion and a second. I'm sure there'll be discussion. Who's seeking recognition for purposes of discussion here?
To open, Mr. Chairman, if I can.
Yes, please, Member Zay.
Thank you, Mr. Chairman. You know, this shouldn't be a surprise. I had mentioned that it was my intention to bring this resolution forward during the JPS meeting. Again, we all want fair and just criminal justice here in DuPage County. It's the way this bill came forward, with it being presented early in the morning, and we can talk about all the public hearings and whatever you want to talk about, but the final bill being brought forward early in the morning. This puts many unfunded mandates on the county of DuPage that they don't have. I mean, they say there's years, some are not years, some are going to take effect this year in 2021, some are not until 2023. There are many good aspects of this bill, but there are some other aspects of this bill that need to be looked at. And when I hear from our top two law enforcement officers in DuPage County, our state's attorney and our sheriff, that there's issues there, that's a concern to me. I'm not a lawyer. I'm a resident like everybody else, but it's a concern. We are seeing already firsthand what the effects of this bill are. We have a carjacking in Addison, and as that suspect, one of those three suspects is apprehended, he makes the comment that he'll be out of custody within days, and then he's going to come back and find and shoot those officers. Do you think that is just arbitrary? We're talking about no bail. We're talking about other things. This part of this bill is sending a bad message. And I was voted in to represent the people of DuPage County. And many aspects of this bill are not good for DuPage County, especially when my state's attorney and my sheriff say they're not, and our judicial system will be weakened by it. Again, there's many good aspects of this law, but there are many aspects that need further discussion. And I know we're a very open and transparent board. We would not move forward with something on the last day of the previous board and have dramatic changes that would make huge effects like the state did. I mean, just hours before the new legislature is going to be sworn in. And we all know what we went through this summer with criminal justice here in the entire United States. Why didn't the state act during those times? Why didn't they do a special convening of them? Why did they wait to the last minute? That's my questions. And then that's, I think, what we need to be looked at. And again, there are many good aspects of this bill, but there are many aspects that need a second look. And let's have the new legislator take a look at this and get it done in this spring session. Thank you.
Thank you, Member Zay. Further discussion, Member Covert.
Thank you, Mr. Chairman. Member Zay brings up a lot of valid points. Here, I spoke with Member Zay last week regarding this resolution, and I did state that I was not comfortable with the language and the word choice of the resolution today. I just want to say I don't think anyone on this county board, Democrat or Republican, is anti-police or anti-minority, not a single person in this room. But the issue is the way that this resolution is phrased. You know, it puts people in a box. If you vote for it, you're called anti-minority. If you vote against it, you're called anti-cop. And I think that's what the problem is. Now, as an attorney who has prosecuted cases at the state's attorney's office in the past, a law enforcement instructor, and a county board member, my analysis of parts of this bill as it affects DuPage County is that there are a lot of good things in this bill, just like Member Zay said, but there are some problematic parts as well when it comes to that need to be revised when it comes to the impact that it will have here in DuPage County, particularly our court system, our state's attorney's office, and our sheriff's department. I think those some parts need to be revised before it is signed. Signed into law, because we will be significantly impacted financially as well. And as a county board member, we do have to look at the finances, make sure how are we going to pay for things. For example, I've been working with the state representatives and ILETSB to see if the unfunded mandates of the body cams maybe we could get a grant for them. Maybe we could get funding through the federal government, for DuPage County. How are we going to pay for these? And maybe we can get grants in the future, but it's something that we need. We definitely need body cams, and we just have to figure out DuPage County how we're going to fund those. And then also, we are losing a significant revenue source for our state's attorney's office and our court system. If we're eliminating cash bail because of the low income level, the indigency of defendants, the effect of taking away that revenue source is we're going to probably have to increase court fees. And the problem is, if you increase court fees, that doesn't help the indigent defendant either. So you're putting them back in the place, where what we're trying to prevent, which is, indigent people cannot pay their bail. But then if you just shift that money over to court fees and increase those, they can't pay those either. And if nobody could pay for this and we pass it on to the taxpayers, then that's a problem too, because taxpayers don't want to pay this bill. So this is a reality of a county board member, of the county board, to decide how are we going to pay for this. But again, I'm not comfortable with the language or the word choice of the resolution. So I will be voting no on this today. And unless it could be amended to maybe have amended to include language, not veto, but to send revise and to revise and then to send back to the governor, because we need this bill, but there's a lot of parts that we need to still work on and to tweak and to refine a little bit more. Thank you.
Okay, thank you, Member Covert. I see in the boardroom we have Member Tornatore seeking recognition, followed by Member Rutledge, followed by Member DeCiani. Let's see if I got the facts three lined up. Okay, please proceed, Member Tornatore, followed by Member Rutledge.
Mr. Chairman, I'm more than happy to speak, but my hand was not up. Member Chaplin's hand was
forgive
up.
me, please. I only see what the cameraman shows me, so please proceed. And the cameraman's doing a fabulous job. Thank you very much. Member Rutledge, please proceed.
It's Member Chaplin that has her hand up. Thank you, Chairman.
Thank you. Thank you, Chairman.
She's just outside the frame here. So let's do Member Rutledge, followed by Member Chaplin, followed by Member Tornatore, followed by DeCiani.
I'll defer to Member Chaplin. I have no comment. Thank you.
Oh boy, okay.
Thank you.
There we go. Member Chaplin, please proceed.
Thank you, Chairman. I don't believe our job as a county board is to debate the merits of this bill. That was done in Springfield. We've been told numerous times to not bring politics to this board floor. The resolution before us is political in nature. Similar resolutions have been presented at local government bodies throughout the state. These efforts have been directed, they're partisan efforts, and they've been directed by people who wish to deepen the partisan divides and divisions among us. And it sets a bad precedent for this board to take a vote on this resolution. So I am going to motion to move to postpone this resolution indefinitely.
Second, Rutledge.
Is that a motion to table?
It's a motion to postpone indefinitely.
Okay, Mr. McCarthy, can I recognize a motion to postpone indefinitely, or is it commonly referred to as a motion to table?
A motion to postpone indefinitely is provided for in Robert's rules. A motion to postpone indefinitely requires a second, and it is debatable. It's unique among Robert's rules in that a motion to postpone indefinitely permits inquiry into discussion into the main question.
Wow, that's very good. You guys have done your homework. Okay, so we have a motion. by Member Chaplin, seconded by Member Rutledge, to postpone this matter indefinitely. Do you want any discussion on this motion before us right now? Member Tornatori, followed by Member DeCiani.
Thank you, Mr. Chairman. I have discussion on the motion. I think the motion is ill-timed. I think it's inappropriate. I think the fact that someone says something is a political statement doesn't make it one. Secondly, I think that this debate on this bill that affects the people in DuPage County of whom we were elected to represent is terribly relevant. And the fact that some people don't want to discuss it because they may or may not think it's political is their choice, but it's not our duty to follow someone's choice. Now, regarding the bill, which I think I have every right to comment on since it's on the agenda, and since it appears that discussion on this is there's an attempt to hijack it, I'm going to comment, quite frankly, and I'm going to pull out a couple of things. I think the bill has many, many sound provisions in it. Unfunded mandates, of course, are something we've learned to live with. As a village prosecutor, I represent police officers, and I can tell you that as a defense attorney for over 40 years, I don't know of a police officer that does not want a body camera on his or her uniform. More times than not, it's going to protect them as opposed to incriminate them. But the suggestion that there's a mandate here, and while there's no penalty, however, they will not be given preference for grants if a municipality or the county does not have body cams, is a penalty in and of itself. But we'll have to live with unfunded mandates as we have. But look at the provisions within the bill regarding police discipline. It removes the requirement that an officer be informed of the names of his complainants or her complainants. It removes the requirement that an officer under investigation be informed in writing of the name, rank, and unit command of their person in charge of the investigation. It removes the requirement that a person filing a complaint against an officer must have a sworn affidavit or other alleged document. A person can file an anonymous complaint against a police officer with absolutely no concern that what they say, if untrue, may be subject to perjury. There's nothing in the legislation which would provide for a penalty for that. Now let's go to the economics. The fact that there may be no cash bail is probably going to hit us with about a $3 million deficit in what we're currently getting. But I don't think that's a reason to have or not have bail. I don't think that a wealthy murderer should be able to get bail when someone who can't afford it should rot in jail. But the reality here is that it also provides that in addition to not having bail, if you don't pay your fines, the Secretary of State loses his opportunity to suspend a license. So someone can continue to get traffic tickets, multiple DUIs, a number of other things, not pay their fines, and they will continue to be able to drive without any penalty, including child support, which has historically been something which the Secretary of State and the state's attorney's office have used to be able to get deadbeat dads to pay their child support for their children. That's off the table. The provision also says that a defendant can make 3 phone calls in 3 hours. Now, they can be in the middle of an investigation or in the middle of a discussion with a police officer and stop it to make a phone call on 3 different times. It also talks about victims. It says that a victim can be called by a defendant who is arrested for purposes of bail, that the defendant can call the victim as a person to testify in his or her bail hearing. Now, let's take that to what may be a horrendous but logical conclusion. Someone's charged with rape. The next day, they're before a judge for a bail hearing, and they call the victim of that rape. The victim of that rape doesn't want to come to court. The victim of that rape doesn't come to court. And as a result of it, the defendant may get bail when, if the victim did come, she or he, depending on the circumstances, may have testified to put that person behind bars until he or she awaits trial. It also says that a person may be called if they're a victim and they can be identified. Well, if you're a leader of a drug cartel, how do you identify who your victims are? If you commit a murder and that person is dead, how is that person called to be identified as a person to be able to testify for you? Now, these may seem to be a bit of a stretch, but trust me, there's going to be lawyers, and I know them, and many of them are my friends, who will use these anytime they can in order to get somebody back out on the street who doesn't otherwise be entitled to do it. I've always taken the position that bail is to ensure the presence of the defendant and also to ensure the safety of our community. I've argued in DUI cases when I've defended them that my client, who may have been arrested 3 or 4 times before, was entitled to bail because he never missed a court date, because he's always appeared in court. I've had habitual criminals always come to court and use that as an argument. It's been rejected. But the fact of the matter is, and I'm pointing out a couple of things here, and then I'll defer to everyone else. I don't want to take up too much more time. But there are provisions in this bill which are horrendous. We can cherry pick, and we listen to public comment about cherry picked ideas that told us we were wrong in bringing this forward. But I think a full and fair discussion, and I think that if this county board chooses not to decide to send a vote, a letter to Springfield, that's fine. That's our decision. But we certainly ought to discuss something which affects not only the economics, but the health and safety of the residents in this county. It's very relevant to us as elected officials to have this full and fair discussion. Thank you, Mr. Chairman.
Well, thank you, Member Tornatore. That's very, very helpful with all that information and hands-on experience. Now, Member DeCiani was seeking recognition earlier, and I see Member Covert. Let me just offer this thought. I know that the state's attorney is in the room, Bob Berlin, who is our chief law enforcement officer. With leave of the body, I'm interested in hearing from him during this point in time. We certainly entertained public comment to a great extent. Seems like we should permit our state's attorney to at least be given the same opportunity to share his thought during this process. So why don't I call on Member DeCiani? Do you want to talk now, Pete, or will you defer? Is there any objection to allowing the state's attorney?
I defer to Bob, and happy to come back after Bob and share my thoughts.
Okay. So Member or State's Attorney Bob Berlin, would you be kind enough to share your thoughts with us at this point, at this juncture?
Respectfully, Chairman, I think we're limited. I think we're discussing the motion. Member
Chapman. Discussion mode about the motion to suspend this issue indefinitely. Seems to me it's not a bad idea to listen to the state's attorney at this point.
Well, I think Robert's rules, according to our state's attorney, said we can still have discussion on the underlying motion. I think that's what Connor said.
That is correct, Member Krajewski. It enters the main motion. It's the only type of motion I'm aware of like this that allows discussion of the main question during it, because it does put an end to the discussion quite abruptly.
So we can continue discussing this even despite the motion.
Correct.
Until we get back to a roll call on the motion, Member Chaplin's motion. So I think at some point there's a little bit of courtesy here, and I think that we ought to call on the state's attorney, please, to share some thoughts with us.
Thank you, Mr. Chairman. So let me just start by talking about how this bill was passed and some of the history behind it. The bill was originally filed on January 5th in the evening, 2021, which would have been 3 days before the lame duck session began. It was filed as House Bill 163, Senate Amendment 2, 611 pages. That bill received on the website 4,199 proponents There were 19,458 opponents. Also, on January 8th, House Bill 841 was filed. That was the police certification bill that our Attorney General, Kwame Raoul, was pushing, that I had worked on with him along with the police chiefs and the sheriffs. On January 10th, House Bill 163 became House Bill 3653, Senate Amendment number 1, again, 611 pages. And then early in the morning, sometime around 3 a.m. on January 13th, which was the last day of the session, that bill became 764 pages. What happened was the General Assembly combined the police certification bill into 3653, and it was amended at 3 a.m., and then it was voted on in the Senate, and it was voted on in the House later on that morning. I want to make it clear, pages 612 to 764 of that bill are the police certification bill. That portion of the bill, which again was originally House Bill 841, we spent months having numerous WebEx conference calls with the Attorney General, with the Illinois Chiefs of Police, with the Illinois Sheriff's Association, and with the Illinois Law Enforcement Training Standards Board, discussing the language of that bill. And there were, everyone had input. There was language that would be shared prior to these meetings. There were changes that were made. And ultimately, the Chiefs of Police, Sheriff's Association, the State's Attorneys Association agreed on the language to that portion of Bill 841, which was then lumped in at the very last minute to 3653. 3653, it's true, they had 30 hours of subject matter only hearings, but in none of those hearings was there any language that was seen by anyone. We talked about subjects, and I actually testified on the cash bail portion sometime in the fall. But it wasn't until 3 days before the lame duck session began that we actually saw the first language, and that was House Bill 163. And the final version was actually amended at 3 in the morning, about an hour and a half before it was voted on by the Senate. I want to just discuss a few provisions of the bill. There's many, and I know Member Tornatori discussed many of them, but the cash bail provision, on page 336, the bill states that detention only shall be imposed when it is determined that the defendant poses a specific, real, and present threat to a person or has a high likelihood of willful flight. That means that for a judge to detain someone, they have to find that the defendant is a specific, real, and present threat to a person, not the community or not anyone else. In a domestic homicide, it would be very difficult for the state to show that they're a threat to a person if the person is deceased. However, in a domestic where a person attempts to kill his significant other or her significant other, and the victim lives, in that case they would be a threat, and the judge would be allowed to detain them. On page 337, the bill states that at each subsequent appearance of the defendant before the court, the judge must find that continued detention is necessary to avoid the specific, real, and present threat to any person or of willful flight from prosecution in order to continue detention of the defendant. Then on page 370, in discussing forcible felonies, the bill states that a person can be detained if they pose a specific, real, and present threat to any person or the community. And that's the only place that the or the community language appears. That was added sometime after 1 in the morning on the 13th, but it is contradicted by other provisions of the bill. Finally, on page 372, there's a list of offenses where judges can detain people, and a list of numerous enumerated gun offenses, but it states that people must allege the defendant's pretrial release poses a real and present threat to the physical safety of any specifically identifiable person or persons, which is going to be extremely difficult to do. I just want to give a few examples of cases that we have seen here in DuPage County where violent offenses were committed by people out on bail. Because the reality is, using the language that is currently in the bill, almost, I wouldn't say every, but most offenders are going to be released pending bail. This past August, there were 2 home invasions committed in Lombard and in Wheaton. The homeowner in Lombard was shot by one of the offenders. One of those offenders was out on a warrant from Cook County for escape. He had cut off his electronic monitoring bracelet. Electronic monitoring is one of the conditions that a judge can impose as part of bail. One of the other offenders in those home invasions was actually wearing an ankle monitor as a condition of his probation, but he still committed, or is alleged to have committed and charged with 2 home invasions. This past October, an armed robbery in Oak Brook at a Shell gas station, 2 offenders. One of them was out on bond on a gun case out of Cook County. After committing the armed robbery in Oak Brook, they then went to Lincolnwood and committed another armed robbery. Then that same day in October, this past October, there was an armed robbery at the T-Mobile store in Bloomingdale at 10:30 in the morning. 3 offenders, 2 of them were out on bond at the time, out of Cook County, one of them on bond for an aggravated unlawful use of a weapon. November 30th of 2019, there was a series of carjackings in Downers Grove and Warrenville. In one of those carjackings, a mom and her daughter, who was home from college, were carjacked in the middle of the day while pulling into their garage. In another one of the carjackings in Downers Grove, the victim, who was pregnant, was sitting in her vehicle in her driveway in the middle of the day when she was carjacked. 3 people were charged. One of them was a juvenile, 2 adults. One of those adults was on bond for an aggravated unlawful use of a weapon case out of Cook County. According to CWB Chicago, which is a website that reports on crime in Chicago, in the year 2020, there were 32 murders or attempt murders or aggravated battery with a firearm, 32 that were committed by offenders who were out on bond. And I bring these numbers up because of the language that's in the bill, and we don't know what the standard is because the bill contradicts itself. Finally, the Bill 3653 provides that failure to appear, whether it's a felony, a Class A, a Category A or Category B case, failure to appear in court would be a misdemeanor only, whereas right now it is 1 class lower. So if you're out on bond on a Class X and you fail to appear, it would be a Class 1 felony. Failure to appear would be a Class A misdemeanor, and in 2018, when Illinois created the Category A and Category B offenses, our failures to appear increased 42% over 2 years in Category A offenses and increased 58% in 2 years in Category B offenses. In 2018, out of those Category B failures to appear, there were 114 that were charged with new offenses after they failed to appear in court for their arrest. 53 of those cases, of those offenses, were felonies that were committed in DuPage County, and of those 53 new felony offenses, there were 10 burglaries, 2 armed robberies, 3 DUIs, 2 unlawful use of a weapon. So the provisions in the cash bail portion of 3653 are significant, and I believe that they will have a significant impact on public safety in DuPage County. A couple other provisions that I do want to bring up that Member Tornatore did not mention. The peace officer's use of force in making an arrest, the language has been changed, and while an officer can use deadly force when confronted with deadly force, if the offender somehow is able to escape or resists being taken into custody, the officer then can only use deadly force if he reasonably believes the person cannot be apprehended at a later date. So the officer responding to a school shooting would be able to use force, but if the shooter was able to slip out the door, the officer could only use force if he felt that, or she felt that the offender could not be apprehended at a later date. One last thing that the bill does do in Class B and Class C misdemeanors, the police will have to issue a citation in lieu of custodial arrest unless they determine that the person poses an obvious threat to the community or a person. This would include cases like telephone harassment or criminal trespass to property. If an officer responds and someone's on someone's property, unless they pose an obvious threat to the community or person, they have to issue a citation instead of an arrest. It takes away their discretion, and the person would then have to appear in court 21 days later. So I want to make it clear that we, the State's Attorneys Association and law enforcement, was significantly involved in the certification provision of this bill. I applaud our Attorney General for taking the leadership on that portion of the bill and for the way it was handled, for the back and forth input that the Attorney General's staff took from everyone around the state. Police chiefs and sheriffs from all over the state of Illinois, state's attorneys across the state of Illinois had input into that portion of the bill. But the remaining portions of the bill, it was subject matter only hearings. There was no language that was actually proposed until 3 days before the lame duck session began. And yes, during that lame duck session, there were some conversations regarding provisions of this bill, including the qualified immunity provisions, ultimately which were taken out. But the fact is the bill was significantly amended at 3 in the morning or thereabouts on the last day of the lame duck session. And I would note that the bill cannot be amended because the 101st General Assembly is no longer in session. We have a new General Assembly that took over on January 13th. So there is no amendatory veto for the governor. If he vetoes a portion of it, the whole bill is vetoed. But the last thing I would say is the state's attorneys, myself, the rest of the state's attorneys, the police chiefs, our sheriffs, none of us are opposed to criminal justice reform. We have actually led the efforts. This certification provision is a significant piece of legislation that was carefully crafted with everyone's input. And we have committed to members of the General Assembly and the leaders of the General Assembly to continuing to work with them. But as has been pointed out, there are provisions in this bill which are, in my opinion, extremely problematic, and I can share that that opinion is shared by many, many police chiefs and sheriffs across this state.
Okay, thank you, Mr. State's Attorney. Appreciate that. Appreciate the courtesy that the board members have afforded our Chief Law Enforcement Officer here. We are, just for context, there's a motion by Member Chaplin, seconded by Member Rutledge. We are immersed in discussion. I did indicate to Member DeCiani that I would recognize him. if he wants to offer some remarks. And I do think Member Covert was seeking recognition as well. Member DeCiani, are you there?
Thank you, Mr. Chairman. I am here. I thought I appreciate State's Attorney Berlin for him explaining all of the challenges with this bill. In addition to some of the challenges that they've already mentioned, issues like I believe they actually took the statute of limitations off of complaints on police officers. So not only can you anonymously, without signing an affidavit, field a complaint against a police officer, you can actually, for instance, to give you an idea, go back to 2006 when my brother was an officer, and he can have a complaint filed against him, even though today he is an emergency room physician. I mean, ridiculous, basically anonymous. It gives more rights to the criminal than it does to our officers, which is really a challenge. There are some very good parts to this bill that, as many of the members from the Republican side of the aisle mentioned, but these challenges that we have with the fact that we did not get, a proper procedure in order to get debate, to get consensus. I mean, this bill passed the House by 60 votes. The bare minimum, and they kept the roll open for 10 minutes. I actually watched the debate on the floor where they, at 11 o'clock called the roll to get this passed. Leader Durkin actually even said, let's, they had, I think they had 58 votes, cancel, finish the roll. Let's get this done with. It barely got to 60. There are some good parts to the bill, but there's also some very bad parts. And I would like to see this put through proper procedure with the new state legislator to have our officers in a, who's going to want to be a police officer these days? We have police officers that are leaving policing because of this law. And how are we going to recruit officers in the future when the criminals have more rights than law enforcement? To me, it's going to be very challenging for mayors and for folks who are trying to protect their residents, as many of us have. Try to recruit good people. The liability that these officers have to take on now is greater. They're likely going to have to go out and buy insurance policies just to protect themselves, given the liability that this legislation puts on them that was not prior put on them. It's very, very difficult to watch this happen. Just the week that it passed, just in Elmhurst alone, we had a home invasion, or not a home invasion. We had a carjacking where a resident of mine in my district was pistol whipped in his driveway, his car taken and gone. Two individuals from Cook County did this. It's very, very challenging. We also had a drive-by shooting within a day after that, where somebody coming in from the east, traveling west on St. Charles Road, shot at my constituent in his car. So again, we're seeing more and more of these criminals be emboldened by bad laws. And, we've always had a situation in the last 4 years or so with the state's attorney to the east not enforcing laws, gun laws, crime laws. Now we've actually got it in code where it's going to make it more difficult for our own state's attorney, who is pro-criminal, he's pro-crime, meaning putting criminals in jail and prosecuting and following the laws. We're weakening our ability to do that. And that to me is just, the manner in which at 3 a.m, this bill was proposed, a new bill number given the fact that 20,000 plus opposed the House Bill 163, which is now part of this bill, which is the egregious part, I believe, that most of us are frustrated with. 3 a.m, 4 o'clock passage, and then 11 o'clock, right before the noon swearing in, the House barely passes it just by the bare minimum, 60 votes. Many Democrats, and I commend them, voted against this bill. Many DuPage Democrats down in Springfield. So I commend those legislators for stepping up, because this shouldn't be a partisan bill. We should all be for having laws to protect our residents. It's not a Democrat or Republican bill. This is about law enforcement. It's about doing what's right. It's about giving our officers the tools they need. I'm all for body cameras. I was for body cameras back when the sheriff was asking for them. But we have to have money to pay for them. There's no money in this. So at the end of the day, the rights of our officers are greatly diminished here. The rights of our residents are greatly diminished here. We're going to see a lot more women victimized because of this legislation. So I am fully supportive of a veto, and I'll go down to Springfield and advocate, along with many of the people in our room to get a good bill, a bill that's going to protect, criminals from bad cops, and a good bill, more importantly, to protect our residents, from criminals that today are more emboldened than ever to go out and commit crime. So with that, I defer. Thank you.
Okay, thank you, Member DeCiani. We move to Member Covert, followed by Member Eckhoff.
Thank you, Mr. Chairman. I'm okay with tabling this issue, just not indefinitely. I think maybe until JPS or a special call, I'm okay with that. I'm just not comfortable with tabling it forever, indefinitely, or I think it's just really about a balance between civilian rights and law enforcement without weakening either one. And again, just like Member DeCiani said, it shouldn't be a partisan issue. We all agree, balance between civil rights and law enforcement without weakening one. I have traveled to developing countries where I have seen the effects of a poorly funded court system and law enforcement system. And it is scary. And when you see that, when you see a fragmentation or disenfranchisement of law enforcement or any weakening of it, there are consequences. There's more crime on the street. I've seen it. And my own family had to hire their own private security. Whenever I went on vacation, I had private guards with me. So that is a reality. And I don't want our state to become like that, obviously. But the way I'm looking at this is purely financial right now. We need to have this bill. All I'm saying is that we are going to end up discussing this one way or another later today or later, because it will come up when we start losing revenue sources from that fund our court system and state's attorney's office and sheriff's department. We're going to have to make some serious budget decisions where we may have to slash some parts of the budget to fund our court systems more. We might have to increase our court fees if we get rid of one part of cash bail, which and we're just going to have to increase it somewhere else, which would be through court fees. And people don't want to pay that either. People that are low income can't afford cash bail, and they cannot afford higher fees. And again, the taxpayers are not going to want to pay for this. So I don't want to. This is a very difficult discussion piece, and a lot of people are not comfortable talking about it. But I want to, I'm talking about it because I talk about difficult issues. But we really have to look at the reality and the financial reality of this bill and weigh in on it. And maybe, Mr. Chairman, maybe you could call the governor, or someone could call the governor and say, hey, just work with us to revise some parts of it before you sign it into law. It could be that simple. So that's all I have. Thank you.
Okay, thank you, Member Covert. We do have Member Eckhoff, followed by Member Zay, followed by Member Schwarzy, all seeking to contribute to this discussion. Member Eckhoff.
Thank you, Mr. Chairman. Sorry I had to step out for a few minutes there and miss some of the initial debate, but I was glad to walk back in and hear the state's attorney say that he is in favor of criminal justice reform. I'm in favor of criminal justice reform. I think we all are. Just how you do it and doing it right. And the problem is the bill that was passed and presented to the governor is a bad bill. And as the state's attorney said, we can't amend it now because the General Assembly that passed it is out of session. So it's got to be redone. And we need to vote on this today because the bill's in front of the governor today. I don't know if he's planning on signing it today, if he's waiting to hear from us or from other people, but it's a current issue, and kicking the can down the road is just going to, it's not going to solve anything. And frankly, a vote to postpone is a vote against the resolution that is here today. So if you want to postpone and you want to vote for that, you're still going to be under the shadow of voting against the resolution. But just a couple of little details, and maybe the state's attorney passed them, but things that struck me when this bill got passed is we are constantly talking about transparency. This county board, it's become the buzzword in America about government, and to have a bill rolled out at 3 a.m. To be voted on by the General Assembly when various issues of it have been discussed before, but not in the way that the police licensing was discussed. As the state's attorney said, our attorney general did a really good job, got the language out that was discussed thoroughly and agreed to by people, but then it got added on as the last 150 pages of the existing bill so that people could write little comments to us at the county board saying this bill's been thoroughly discussed, and that just isn't the case. So if you want to talk about transparency, and frankly I don't want to hear that word again, if you vote to postpone or you vote against this resolution, then do that. But if you're really in favor of transparency, then you should be voting for or against this resolution today, and frankly, I think you should be voting for it. The second thing is, it's amazing to me when we're in the middle of COVID-19 and local governments, state governments, all governments are suffering financially, and we know that hard times are coming, maybe even worse times are coming, that you get an unfunded mandate from Springfield that's going to cost this county multi-millions of dollars. And it's not just going to cost multi-millions of dollars because you got to buy a camera. Those things are pretty cheap. They want you to buy the cameras just like they wanted you to buy the phones 20 years ago, so you'd spend a lot of money on your time on your phones. Well, now they want you to spend lots of money on the storage fees. We did 3 years ago when Sheriff Zaruba applied for a grant for body cams. We did some homework and figured out that although the grant was going to save us some money for a little period of time, there was going to be about $30,000 a year per individual who's wearing a body cam. It's my understanding that the sheriff's office under this bill is going to have body cams of over 100 people. So do the math. It's going to be a multi-million-dollar obligation starting next year because of what this General Assembly passed. But the expense is not just to the sheriff's office in buying the body cams and storing the video. You also have additional pressure on the state's attorney's office and the public defender's office, because now the state's attorney's office is going to get FOIA'd for additional for the tapes, for the video from the public. And when you turn over that video, you have to redact portions of the public. They have nothing to do with whatever the video was about. So that takes additional state's attorneys and additional hours. And the public defenders, we know, through this COVID-19 has already been overburdened by the fact that they are having to take cases that the private attorneys took before because the people cannot afford the private attorneys anymore. But even if that wasn't the case, even if everything was okay, this is still going to put an additional burden on the public defender's office to view hours and hours and hours of videotape. And we're going to have to hire additional personnel in the state's attorney's office. We're going to have to hire additional personnel in the public defender's office just to deal with this. And there's been no provision for that at all. So start thinking about, if this bill gets signed, how you're going to come up with another $3 or $4 million for next year. And I've heard, so some people said there's no penalty on this bill. You don't have to worry about it. You don't have to follow the bill. Well, we follow the laws here in the state of Illinois and in the county of DuPage. And even though it's a bad bill, if it gets signed, we're going to follow it and we're going to get stuck with another $4 million. So start thinking about that for your next budget in September. And the last thing is, it's mind-boggling to me when we hear the state's attorney talking about how crime is surging throughout the county, throughout the state. I read yesterday about somebody who had 2 pending charges in Cook County, getting car crashing into somebody and killing them. Just in Kane County yesterday. We've got carjackings out here going through the roof because basically there's no consequences. I thought I heard a report that the person who was eventually arrested for that told the police officers he'd be out in a couple of hours and he'd come and look for them to kill them. So it's mind-boggling to me how when you've got crime surging that your solution is to put more criminals on the street. That doesn't seem to be very good. So if you want to violate your transparency oath, you want to put another $5 million on the back of the taxpayers here in DuPage County, and you want to put more criminals in the street when they're already committing a higher number of crimes, then vote to postpone or vote against this resolution. But that's not what I think we should be doing. Thank you, Mr. Chairman.
Okay, thank you, Member Eckhoff. We have Member Zay, followed by Member Schwarzy.
Thank you, Mr. Chairman. This is on the motion to postpone. And you know what? I probably shouldn't, but, Member Chaplin, I'm very disappointed in your comments that this is political. I am really tired, frankly, of hearing that now 2 out of the last 3 meetings, the other members on the other side of the aisle being told that there's political issues. You know what? We're all elected. It doesn't matter if you're here 21 years or 21 days or 5 years or whatever. We're all elected by the people to give our opinions. And this has nothing to do with politics. I brought it up in JPS. My question is this the new leadership we have on the county board? To cut off public comment and to end debate on issues that you don't like? I respect all your opinions. We've never done that before. When issues have been brought forward by a signature of 6 members on the board, we've had debate. We've had votes on that. But now all of a sudden, because there's new leadership, we're not going to allow that anymore on an issue like this? I'm just saying, is this the way we're going? Is this 2 out of 3 meetings where certain members on this board are being political and calling out the other party by name on the board floor, saying that we're doing this? It's never been done before. Never. I don't understand that. This is about the bill. I brought it up in JPS. That was 2 weeks ago when we talked about it. Nothing about it. And I guarantee you, if this was political, certain websites, certain Facebook pages, certain things, you think we would have got more public comment than what we did today? We didn't do that. We didn't put anything out. This was the issue. We probably got more public comment against it because we didn't want it to be political and put it on a political Facebook page or a political website. So again, I'm disappointed. This seems to be the new leadership we have, that we're going to cut off discussion and have open opinions on issues and just feel, well, I don't want to talk about it. I don't want to vote on it. So let's use a maneuver to get out of it.
Point of personal privilege.
Yes, your name was used in discussion, Member Chaplin.
The reason why I use the motion to postpone indefinitely, because it does allow for discussion. Right now, we discuss the merits of this resolution, and then we vote to postpone indefinitely if we so choose. Secondly, the reason I brought this forward, this is an overreaching resolution. What about next week? Next week, if we bring forward a resolution to impeach, that the Congress should impeach President Trump, or we bring forward a resolution that on abortion rights, where does it stop? I mean, this is out of our preview as a county board. This is totally inappropriate resolution, and that is why I called to postpone this resolution indefinitely. It is totally inappropriate and sets a bad precedent, because once you open the floodgates, you don't know what's going to come through. And that is my point. Thank you very much.
Okay, thank you, Member Chaplin. Member Schwarzy was seeking recognition.
Thank you, Mr. Chairman, and thank you to everybody on this board for their sincere comments. It's obvious that everybody is passionate and everybody cares about this community, and as do I. And I guess the issue that I have is the timing of this. Truthfully, I need to know more about this. I've been doing my due diligence. I've been talking to people. I've been talking to police officers, people on the public safety side. I've been talking to some of my legislation, asking them about it, and I'm getting conflicting comments on different aspects of the bill. And I personally do need to hear more, and I do believe JPS is planning on putting together some sort of educational discussion on this coming up soon. So, right now I'm at the point where I wouldn't necessarily make a recommendation to approve or veto this bill just because I feel like I need some more information. And then I want to bring up my next point about the politics of all this. And Member Covert has brought some of this stuff up appropriately. So I think I'm going to get maybe a little more passionate about it. And somehow, over the last year, especially maybe the last couple of years, the policing, public safety versus criminal justice reform, Black Lives Matter, has been turned into an us versus them issue, and so it has been political. And I'm not saying that's what this is, but it's out there. And a person gets boxed in as being either pro-police, which makes them racist, or they're pro-Black Lives Matter, which makes them anti-police. And I'm here to say that's, for a better lack of term, is BS. And I'm proof you can be both. I'm living proof that you can support both. As a longtime firefighter, I've worked extremely close with our police officers. I'm friends with them. I've gone out to dinner with them. I've worked side by side with them. I've been on calls where people take swings at them, call them names and spit on them. I've battled together at times with police officers to gain control of a violent patient. So as a paramedic, I'm able to render care. So we're fighting some of the same battles. As a former municipal elected official, I've sat in closed session fighting for fair salaries and benefits for our FOP. And in fact, I remember sitting as the lone voice in a closed session fighting to allow our sergeants to unionize. So when police take their oath of office, they raise their hand and they don't use these words, but they say they're swearing on the oath to do their duty up to and including death. It's a thankless job and they only see people at their worst. Now I want to flip the coin over. I can't realistically truly understand what it's like to be a minority, especially African American, when it comes to the relationship with law enforcement. But what I can do is I can be empathetic and I can listen to people. I've sat through meetings, this past summer, I sat through a couple of Zoom meetings with the DuPage County NAACP chairman, President Michael Childress. I heard his real life experiences. I've heard the experiences that he shared that involved his family, his friends, his acquaintances with regards to, interactions with law enforcement. And some of the stories are very disturbing and very scary. We're very fortunate to live in DuPage County where our men and women in blue are nothing short of superheroes in my mind. I see it all the time. But all it takes is for us to watch the news to see what's going on in other parts of the state and the country to realize there's some broken parts to our criminal justice system. Those broken parts need fixed. We all know it. I just don't like this us versus them thing. I look forward to learning more about this bill. So thank you very much.
Okay, I don't see anyone else seeking recognition for purposes of discussion on the motion. The motion, as moved by Member Chaplin and seconded by Member Rutledge, is to postpone indefinitely this subject matter of this crime reform bill. Seeing no further discussion, no one else seeking recognition, I will call on the deputy clerk to call the roll on this motion to postpone indefinitely. Mr. Clerk, please call the roll.
Thank you, Mr. Chairman. Chaplin.
Aye.
Chavez.
Aye.
Covert.
No.
Desart.
Aye.
DeCiani.
No.
Eckhoff. Garcia.
Aye.
Hart.
No.
Krajewski.
No.
LaPlante.
Aye.
Ozog.
Aye.
Pachalski.
No.
Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori. And Zay.
No.
Ten voting aye, 8 voting nay.
Okay, well, the postpone indefinitely motion is adopted, so that settles that. Back to the order of business entitled County Board, Member Ashley Salmon.
Thank you, Mr. Chairman. I move on CBR 88-21, a resolution for the appointment of the Honorable John W. Demling to the DuPage County Ethics Commission.
Second to start.
Been a motion and a second. Mr. Clerk, please call the roll.
Selman.
Aye.
Tornatore. Zay.
Aye.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart.
Aye.
Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Most enthusiastically, aye.
Pachowski.
Aye.
Renahan.
Aye.
Rutledge.
Aye.
And Schwarzy.
Aye.
Thank you, Mr. Clerk. Member Selman.
Thank you. And lastly, I move on CBR 89-21, a resolution for the appointment of William S. Hable to the DuPage County Ethics Commission.
Second.
Chavez.
There's a motion by Member Selman, seconded by Chavez. Mr. Clerk, please call the roll.
Selman.
Aye.
Tornatore. Zay.
No.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart.
Aye.
Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
Pachowski.
Aye.
Renahan.
Aye.
Rutledge.
Aye.
And Schwarzy.
Aye.
I'm sorry, Mr. Clerk. I was wrong. Change my vote to aye, please. I'm sorry.
Okay.
All right, unanimously adopted for Bill Hable. Okay, thank you, Member Selman. A fine report. On to the order of finance, Member Liz Chaplin.
We can't hear you, Member Chaplin, if you're speaking.
Speaker on. Okay, can you hear me now? Sorry, I didn't have my microphone on. I move to combine items A through C, all acceptance and appropriations.
Okay, there's been a motion by Member Chaplin, seconded by Member Rutledge to combine items A, B, and C. Mr. Clerk, please call the roll.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart.
Aye.
Krajewski. LaPlante.
Aye.
Ozog.
Aye.
Pachowski.
Aye.
Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatore.
Aye.
And Zay.
Aye.
Okay, the items are combined. Please proceed, Member Chaplin.
Thank you. I move to approve item A, FIR 008021, resolution, acceptance and appropriation of the DuPage Animal Friends Foundation unrestricted grant for year 2021, excuse me, in the amount of $50,300. Move to approve FIR 008121, resolution, acceptance and appropriation of additional funding for the Illinois Department of Human Services Emergency Grant Fund Solutions, amount of $3,076. And I move on item C, FIR 008221, resolution, acceptance and appropriation of the Illinois Department of Commerce and Economic Opportunity Community Services Block Grant for $1,075,376.
Okay, there's been a motion and a second. I see in the boardroom there, Mr. Deputy Clerk, you can see the second. Please call the roll.
Chaplin.
Aye.
Chavez. Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart.
Aye.
Krajewski. LaPlante.
Aye.
Ozog.
Aye.
Pachowski.
Aye.
Renahan.
Aye.
Aye.
Rutledge.
Aye.
Schwarzy. Schwarzy.
Aye.
Selman.
Aye.
Tornatore.
Aye.
And Zay.
Aye.
Okay, thank you, Mr. Clerk. Member Chaplin.
Thank you, Chairman. I move to approve FIR 008721 resolution placing names on payroll.
Second, Rutledge.
Been a motion and a second. Mr. Clerk, please call the roll.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart.
Aye.
Krajewski. LaPlante.
Aye.
Ozog.
Aye.
Pachowski.
Aye.
Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori.
Aye.
And Zay.
Aye.
Thank you, Mr. Clerk. Member Chaplin.
Thank you, Chairman. I move approval on FIR 0090-21 resolution. Recommendation for the approval of a payment to the Emergency Telephone System Board of DuPage County for the reimbursement of COVID-eligible expenses for a total
Second,
amount
Schwarzy.
of $17.95.
Thank you. There's been a motion and a second. Mr. Clerk, please call the roll.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart.
Aye.
Krajewski.
Aye.
LaPlante.
Aye.
Ozog. Ozog.
Aye. Sorry.
Pachowski.
Aye.
Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori.
Aye.
And Zay.
Aye.
Thank you, Mr. Clerk. Member Chaplin.
Thank you, Chairman. I move to combine items F through J, all our additional appropriations.
It's been a motion to combine F, G, H, I, and J, seconded by Member Rutledge. Mr. Clerk, please call the roll.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart.
Aye.
Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
Pachowski.
Aye.
Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori.
Aye.
And Zay.
Aye.
Okay, the items are combined. Please proceed, Member Chaplin.
Thank you, Chairman. I move approval on FIR 009221 resolution, additional appropriation for the Addison Township Reimbursement Fund of $300,000. I move approval of FIR 009321 resolution, additional appropriation for the Downers Grove Township Reimbursement Fund, amount of $200,000. Move approval of FIR 009421 resolution, additional appropriation for the general fund of $9,058,500. Move approval of FIR 009521 resolution, additional appropriation for the general fund of $462,472. Move on resolution FIR 009621, additional appropriation for the general fund in the amount of $284,285.
Second, Rutledge.
And a motion and a second. Mr. Clerk, please call the roll.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani. DeCiani. Eckhoff.
Aye. DCNE, aye.
Garcia.
Aye.
Hart.
Aye.
Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
Pachowski.
Aye.
Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori.
Aye.
And Zay.
Aye.
Thank you, Mr. Clerk. Member Chaplin.
Thank you, Chairman. I move approval of FIR 009721 resolution approving an extension to the grant agreement with Bensonville Wooddale Food Pantry. COVID.
Second, Selman.
And a motion and a second by Member Selman. Mr. Clerk, please call the roll.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart.
Aye.
Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
Pachowski.
Aye.
Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori.
Aye.
And Zay.
Pass. I guess aye. It's not fun to be last all the time.
Okay, thank you, Mr. Clerk. Member Chaplin.
Thank you, Chairman. I move approval of FIR 009821, resolution recommendation for the approval of the payment to the DuPage County Health Department for the reimbursement of COVID-19 eligible expenses in the amount of $1,667,436.75.
Okay, there's been a motion and a second by Member Desart. Mr. Clerk, please call the roll.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart.
Aye.
Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
Pachowski.
Aye.
Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori.
Aye.
And Zay.
Aye.
Thank you, Mr. Clerk. Member Chaplin.
Thank you, Chairman. I move to combine items M and N, acceptance and appropriations.
Motion to combine items M and M, and so moved by Chaplin, seconded by Rutledge. Mr. Clerk, please call the roll.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart.
Aye.
Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
Pachowski.
Aye.
Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori. And Zay.
Aye.
Member Chaplin.
Thank you, Chairman. I move approval of FIR 010021, resolution acceptance and appropriation of the Illinois voter registration grant in the amount of $150,134. And I move approval of FIR 0102-21, resolution acceptance and appropriation of the Help America Vote Act election security grant in the amount of $110,921.
So moved. Rutledge.
Garcia.
Seconded by Garcia. Mr. Clerk, please call the roll.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart.
Aye.
Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
Pachowski.
Aye.
Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori.
Aye.
And Zay.
Aye.
Thank you, Mr. Clerk. Member Chaplin.
Thank you, Chairman. I move approval of FIR 0103-21, resolution budget transfers dated 1/26/2021.
Okay, there's been a motion and a second by Member Rutledge. Mr. Clerk, please call the roll.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart.
Aye.
Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
Pachowski.
Aye.
Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori. And Zay.
Aye.
Okay, thank you, Mr. Clerk. Member Chaplin.
Thank you, Chairman. I move approval of FIC 000121, recommendation for the approval of a second amendment to resolution FIP 022519, issued to Corvell Corporation to provide third-party administrator claim services to the county to increase the contract in the amount of $12,558, resulting in an amended contract total not to exceed $127,208, an increase of 10.98%.
Okay, there's been a motion and a second by Member Rutledge. Mr. Clerk, please call the roll.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia. Garcia.
Aye.
Hart.
Aye.
Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
Pachowski.
Aye.
Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori.
Aye.
And Zay.
Aye.
Thank you, Mr. Clerk. Member Chaplin.
Yes, and finally, I move to receive and place on file informational item Mesro Insurance. Oh, I can't talk. My blood sugar's dropping. Mesro Insurance Services purchase of healthcare liability insurance for the jail for a period of December 1st, 2020 to December 1st, 2021 for a contract total not to exceed $504,436.
Rutledge, second.
There's been a motion and a second. Mr. Clerk, please call the roll.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart.
Aye.
Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
Pachowski.
Aye.
Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori.
Aye.
And Zay.
Aye.
Okay, thank you. That concludes the Finance Committee agenda. I think maybe we take a little break here now, a little refresh ourselves, rejuvenate ourselves, maybe not long, maybe 14 minutes or so, and we'll get right back at it, okay? I know we have a lot more to get through, and I know that Member Desart has her legislative committee, so please forgive me, but some people have, bladders are, they have limitations, so why don't we take care of that personal business, maybe a little nutrition, and we'll be right back at it in about 14 or 15 minutes. Thank you so much. Why don't you go ahead just for housekeeping purposes and do a roll call, please. And thank you, everyone, for agreeing to this little break. Deputy Clerk Johnson, please call the roll.
All right. Chaplin.
Here?
Chavez.
Here.
Covert.
Here.
Desart.
Here.
DeCiani. Eckhoff. Garcia.
Here.
Hart.
Here.
Krajewski.
Here.
LaPlante.
Here.
Ozog. Pachowski.
Here.
Renahan.
Here.
Rutledge.
Here.
Schwarzy.
Here.
Selman.
Here.
Tornatori.
Here.
And Zay.
Okay, we have a quorum. We move on to the order of business entitled Development. Member Sam Tornatori.
Thank you, Mr. Chairman. Good afternoon. If I may, I'll remain in my seat so I can speak directly into the microphone. Under Chairman's committee report, it has to do with the matter before us today. As you may know, there's been much public comment on the matter under development, both today and in the past and at the Development Committee meeting. I apologize to those people who emailed me, texted me, or called me with my failure to respond. I didn't mean to be uncooperative. I just didn't think it was appropriate for me to have ex parte discussions with one side versus the other. The matter before us this morning comes from a denial from the Zoning Board of Appeals, which as a result we believe would require a 3/4 vote or supermajority. It's also a denial from the Development Committee, both 5-1. At the Development Committee, there was an appetite to refer this matter to the Zoning Board of Appeals. We did not do that based on a tentative objection from the petitioner's attorney, so we decided that we would refer it to the county board and let the county board decide to vote it up or down or refer to the Zoning Board of Appeals. Based on what I heard this morning from the attorney from the petitioner, while I will be moving to approve the matter for procedural purposes and hope to get a second on that, I will also state that I would have no objection to an amendment to my motion, that amendment being a referral or remanding it to the Zoning Board of Appeals. That being said, I move to approve DCO 0011-21, Ordinance Z2059, West Suburban Athletic Development Corp. to approve zoning relief or rezoning from R2 to B-1-2 and a planned development with exceptions within the planned development for a recreational center and restaurant as needed yard reductions. I will not go through all of the exceptions. They are in your packet. They are on the agenda. If anyone wants me to read them, I will, but you can see them for yourselves. This matter was denied at the Zoning Board of Appeals and the Development Committee, requiring a supermajority or 3/4 vote to approve. So moved, Mr. Chairman.
So moved by member Sam Tornatore. Is there a second?
Second by Chaplin.
Seconded by Chaplin. Any discussion? I see member Covert seeking recognition.
Yeah, I'd like the record to reflect that I'm stepping out on this. There's been a recent development where I do have a conflict, Mr. Chairman.
Okay, so Mr. Clerk, please note for the record that member Covert is now deactivated her participation in this meeting electronically. She's effectively left the room addressing this issue in accordance with our rules. I have member Hart seeking recognition.
Thank you very much, Mr. Chairman. I want to thank all of the concerned citizens and everyone that we've heard from on this matter. I, too, like member Tornatore, have received a number of emails, calls, texts on this, and I'm fully cognizant of the fact that there are some serious and I think valid concerns from the community that's impacted in Timberlake. I do also know that there was, as member Tornatore mentioned, discussion about maybe referring this back to the ZBA. I would not support that. I believe that the citizens that have spoken on this have made their voices clear. I'm not sure what resolution could come by sending it back to ZBA, so I would prefer an up or down vote on this. And I also want to make note, there were a number of individuals who had submitted public comment that were not able to have their points heard, at least audibly. So there are a number of individuals that submitted against this matter that we didn't necessarily hear from. I know their comments are for the record, and I encourage everyone to look at them. But I have concerns about this. I think the community does as well, and I'll be voting no on this development. Thank you.
Okay, thank you, member Hart. Member Krajewski.
Thank you, Mr. Chairman. I echo some of my colleague, Mr. Hart's comments, but I'd just like to ask the clerk, Adam Johnson, did we have many more public comment on this matter that we did not read into the record?
Member Krajewski, I was not reading ahead in the public comment. I was just reading them as they came.
So you have a whole bunch of them, but you don't know if they were regarding that or not?
That's correct.
Okay, just for the committee that's looking at our board rules, one thing, if we had a number of public comment today that didn't have anything to do with agenda items, like eating lunch outside, those would be good ones to put in the record for us to read in the future. But, you know, I'd like to hear residents, especially when we're voting on something, at public comment. That's their opportunity to talk to us. So we cut that comments off today. There may have been more in there that we didn't get a chance to hear. With that, I voted against this in development. I clearly don't believe it met the criteria that they asked for. I know at development and even now they've asked for a lot of changes from what came into the ZBA hearing, substantial changes in my opinion, but they brought it for ZBA the way they brought it, and I think we should vote on it today. Thank you.
Okay, anyone else? Member Renahan.
Thank you, Mr. Chairman. You know, I echo my District 3 colleagues' opinion here. You know, I appreciate everyone who has called, written, emailed, texted. You know, there's, you know, very strong opposition to this in District 3. I personally am a soccer mom. I have driven to Rockford so many times because that's where the events are. But the challenges that we bring to this community are just, to me, it just tips the scales heavily in favor of not having it in this area of unincorporated DuPage, and I would take the up or down vote today.
Okay, thank you, member Renahan. Further discussion, member Schwarzy, followed by member Ozog.
Thank you, Mr. Chairman. My concerns echo everybody else's. I just wanted to stress the fact that anytime a fire department, fire district has some concerns, it's more than just a not in my backyard issue. There's some serious issues. So I'll be voting no.
Thank you, member Schwarzy. Member Ozog, followed by member Garcia.
Thank you, Mr. Chairman. I think this request goes back to the original purpose for zoning, and this is a residential area, and I will be voting against this plan. I've received at least 20 emails 100% against this, and it will fundamentally change the use of this neighborhood for these homeowners. And I think it's just not, it won't work there. Thank you.
Thank you. Member Garcia.
Thank you, Chairman Cronin. I also am in agreement with my colleagues here. I actually drove out to the area, and I want to thank everyone who submitted comments and insights into why they actually were feeling one way or the other. Actually, quite honestly, I think I only got like 1 for, and everything else I got was opposed to this project. And so I drove out there and actually viewed the whole area, and I just, in the area that it is going to be quite, I think, a project that's going to affect the Timberlake community in all the wrong ways, as well as Waterfall Glen Forest Reserves. And I'm a little concerned with the wetlands and what it would do to that. So I will be voting no on that, as I think it is the wrong use, and I think the land use plan didn't call for it. I think we need to stick with what the land use actually stated. Thank you.
Okay, further discussion, Member Chavez.
Thank you, Chairman. I just wanted to say that although I'll be voting no on this today after talking with especially the district representatives, that coming from an economic development standpoint and as the new chair, I do think we need to look at some of these facilities because of the revenue that they can bring into our county. So if we can look at these zoning areas, if we can work with this developer to find a spot for it, these are very much revenue generating venues that can bring money to hotels, can bring money to restaurants, people coming into town. So I hope that we can find another spot for this that's a little bit better suited.
Okay, very good, Member Chavez. Anyone else seeking recognition? We do have a motion by Member Tornatori, seconded by Member Chaplin. Mr. Clerk, please call the roll.
Tornatori.
No.
Zay.
No.
Chaplin.
No.
Chavez.
No.
Covert. Desart.
No.
DeCiani.
No.
Eckhoff. Garcia.
No.
Hart.
No.
Krajewski.
No.
LaPlante.
No.
Ozog.
No.
Pachowski.
No.
Renahan.
No.
Rutledge.
No.
Schwarzy.
No.
And Selman.
No.
Okay, thank you, Mr. Deputy Clerk. Thank you, Member Sam Tornatore.
Thank you, Mr. Chairman.
On to the Order of Health and Human Services, Member Renahan.
Thank you, Chairman. I have some good news to report. The DuPage Care Center is now a 5-star facility. Janelle Chadwick sent me some information just to share with everyone. A 5-star quality rating is to help consumers, their families, and caregivers to compare nursing homes. And it's also used by insurance providers and hospitals to determine where to send their patients for high-quality post-acute care. So a 5-star rating uses data from health inspections, staffing, and 18 different quality measures to rate facilities' performance. So congratulations to Janelle Chadwick and her team. Given this rating during a pandemic is just fantastic. I'm so proud of them. And Janelle extends her thanks to the county board and county leaders for their continued support.
Very nice.
And with that, I'd like to move to combine items on Health and Human Services 11A, B, and C.
Been a motion to combine A, B, and C. So moved by Member Renahan, seconded by Member LaPlante. Mr. Clerk, please call the roll.
Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori. Zay.
Aye.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart.
Aye.
Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Oh. Aye.
And Pachowski.
Aye. Aye.
Okay, thank you, Mr. Clerk. Member Renahan.
With that, I'll move approval of item HHS Resolution 8321, authorization of application for emergency solutions grant for community services. HHS Resolution 8421, recommendation for approval of a third modification of community development block grant with the DuPage Department of Community Services, single family rehabilitation program, project number CD 19-21, increasing the award amount to $250,000 and extending the project completion date. And also HHS, our Resolution 8521 for additional approval, first modification of home investment tenant-based rental assistance response program, memorandum of understanding with DuPage County Community Services, project number HM 19-07, updating language, dollar amounts, and extending completion date.
Okay, thank you, Member Renahan. Mr. Clerk, please call the roll. There's been a motion by Member Renahan, seconded by Member LaPlante. Please call the roll.
Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori. Zay.
Aye.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart.
Aye.
Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
And Pachowski.
Aye.
Okay, thank you, Mr. Clerk. Member Renahan.
Thank you, Mr. Chairman. Finally, I move approval of HHS Resolution 86-21, 2021 Annual Action Plan, DuPage County Consortium, first reading, acceptance of the Annual Action Plan element for 2020 through 2024 consolidated plan for CDBG, home, and ESG to qualify and receive HUD grant funds.
Okay, thank you, Member Renahan. So moved, seconded by Member LaPlante. Thank you, Member LaPlante. Mr. Clerk, please call the roll.
Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori. Zay.
Aye.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia. Garcia.
Aye.
Hart.
Aye.
Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
And Pachowski.
Aye.
Okay, thank you, Mr. Clerk. Thank you, Member Renahan. A fine report. On to the order of business title Public Works, Member Ozog.
Thank you, Mr. Chairman. I move for approval of PWP 001921, recommendation for the approval of a contract to Home Depot for maintenance, repair, operating industrial supplies and related products for a 4-year period from February 1st, 2021 through January 31st, 2025 for Public Works for a total contract amount not to exceed $100,000, pricing in compliance with ILCS 525/2, quote, Government Joint Purchasing Act, U.S. Communities Contract number 1615-4.
Okay, there's been a motion by Member Ozog, seconded by Member Schwarzy. Mr. Clerk, would you please call the roll?
Ozog.
Yes.
Pachowski.
Aye.
Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori.
Aye.
Zay.
Aye.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart.
Aye.
Krajewski.
Aye.
And LaPlante.
Aye.
Thank you, Mr. Clerk. Thank you, Member Ozog. On to the order of technology, Member Ashley Selman.
Thank you, Mr. Chairman. I move on TEP 20-21, a recommendation for the approval of a contract to Dell Inc. for a Microsoft Unified Support Agreement for a period of February 1st, 2021 through January 31st, 2022 for a contract total of $142,364.26 per Governmental Purchasing Agreement Act.
Second, Rutledge.
Okay, so moved by Member Selman, seconded by Rutledge. Mr. Clerk, please call the roll.
Selman.
Aye.
Tornatori. Zay.
Aye.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart.
Aye.
Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
Pachowski.
Aye.
Renahan.
Aye.
Rutledge.
Aye.
And Schwarzy.
Aye.
Okay, thank you, Mr. Clerk. Thank you, Member Selman. On to the order of transportation, Member Pachalski.
Thank you, Mr. Chairman. On committee update, I just want to thank our employees in transportation, public works, and stormwater for the great job they did. Our roads are in good shape. They're plowed, passable, and they started yesterday afternoon and worked through the night. So another good job by our employees. That being said, I'd like to combine agenda items A, B, and C, which are all approvals of contracts.
So moved by Member Pachowski, seconded by Member Selman. Mr. Clerk, or please call the roll. Mr. Deputy Clerk.
Pachowski.
Aye.
Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori. Zay.
Aye.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart.
Aye.
Krajewski. LaPlante.
Aye.
And Ozog.
Aye.
Thank you, Mr. Clerk. The items are combined. Please proceed, Member Pachalski.
Thank you. I would move to approve DTP 1621, which is approval of contract to Pollock Appraisal Group, Inc. for professional appraisal and renewal of appraisal services not to exceed $90,000. Move to approve DTP 1721, a contract to Bowman Consulting Group Limited to provide Phase 2 engineering services for improvements not to exceed $299,216.30. And move to approve DTP 1821, a contract to Intera Incorporated to provide professional geotechnical and materials engineering services upon request of the Department of Transportation not to exceed $50,000.
Okay, thank you. There's been a motion. Is there a second?
Second, DeCiani.
Seconded by Member DeCiani. Mr. Clerk, please call the roll.
Pachowski.
Aye.
Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori.
Aye.
Zay.
Aye.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart.
Aye.
Krajewski.
Aye.
LaPlante.
Aye.
And Ozog.
Aye.
Thank you, Mr. Clerk. Member Pachalski.
Mr. Chairman, I move to combine agenda items D, E, F, and G, which are all amendments to resolutions.
And a motion to combine.
Second.
Seconded by Member Selman. Mr. Clerk, please call the roll.
Pachowski.
Aye.
Renahan.
Aye.
Rutledge.
Sorry, aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatori. Zay.
Aye.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart.
Aye.
Krajewski. LaPlante.
Aye.
And Ozog.
Aye.
Okay, the items are combined. Please proceed.
Thank you, Mr. Chairman. I'd move to approve DTR 544A16, amendment to a resolution to a local public agency agreement between the County of DuPage and Illinois Department of Transportation for improvements to increase the funding of $19,776.06, resulting in a county cost of $78,797.06. Move to approve DTR 293A20, amendment to a resolution to Markham Construction for the 2020 retaining wall project program to decrease the funding in the amount of $14,547.23, resulting in a county cost of $290,628.17 and a decrease of 4.77%. Move to approve DTR 264A20, amendment to a resolution as to K5 construction for the 2020 pavement maintenance north program and decrease the funding in amount of $116,845.96, resulting in a county cost of $3,655,969.77, a decrease of 3.10%. And finally, move to approve DTR 265A20, amendment to a resolution issued to K5 Construction for the 2020 Pavement South Program to decrease the funding in amount of $211,819.84. resulting in a final cost to the county $4,286,903.39, a decrease of 4.71%.
Second,
Okay.
Second.
And a second by, who was that second? Selman? Yes, Member Selman. Mr. Clerk, please call roll.
Pachowski.
Aye.
Renahan.
Aye.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Aye.
Tornatore.
Aye.
Zay.
Aye.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart.
Aye.
Krajewski.
Aye.
LaPlante.
Aye.
And Ozog.
Aye.
Okay, thank you, Mr. Clerk. Thank you, Member Pachowski. On to the next order of business, and that concludes our committee reports. We move on to the next order of business entitled Discussion. I think we've dealt with this once before with our new board members, but this is an item that we're required to address by Illinois law, and it is entitled the Pension Obligation Projections Required by Local Government Wage Increase Transparency Act. Is anyone seeking recognition on this subject matter? Seeing none, hearing none, we move on to the next order of business entitled Old Business. Old Business. Anyone seeking recognition on the order of old business? I see Member Garcia holding her hand up. Please proceed.
Hi, thank you, Chairman Cronin. I am looking forward to actually finally coming into the boardroom and being a part of in the boardroom. I have been kind of staying away. Well, first of all, because I had COVID, you didn't want me there. But what's been concerning me is the taking off of the masks when you talk. And I'm just hoping that we can, as a board, maybe come to the conclusion that as leaders of DuPage County that we would just keep our mask on at all time when we talk. I just think that they've done so much with the room, with putting the plexiglass up and making it safe for everybody. But then when we're taking off the mask to talk, or we stand up to talk without a mask on, it's defeating the whole purpose. So I'm just asking, as the board, as we could maybe all agree to do that, so maybe we can all finally come back and be a board together and be the team that we need to be in the same room. So that's all I'm asking. So thank you.
Anyone else seeking recognition on the order of old business? Old business, Member DeCiani.
Yeah, I would just like to, state my disappointment with our vote on not letting that law enforcement resolution go to the floor. You know, we as a group have waited on state issues. We waited on a Medicaid issue regarding autism, and some of the Republicans initially in committee were a little hesitant on telling the state how we should be acting and how they should be acting. But at the end of the day, we all came together and voted on that resolution. It was unanimous that we told Springfield that they weren't doing the right thing when it came to how they were handling their Medicaid funds with people with disabilities. So, when we are having to deal with the ramifications of Springfield's laws, I think it's important for us to be able to weigh in as a group. Again, this is not a partisan issue. Crime and criminal justice reform are bipartisan issues that hopefully we could all come to agree on. So I was a little disappointed that we weren't able to get this to the floor and actually have this go to Springfield with one or the other. And I'm hoping in the future we can put our partisanship aside, and as leaders, and I've always been a pretty independent person, been able to come together to do the right thing. So I would hope, no matter what the majority is, that we can work together and weigh in on issues that are important at the end of the day to our residents, the people that put us in office. We look at our referendums that were put on for advisory with law enforcement. They passed astoundingly in favor of funding law enforcement and actually help supporting law enforcement. So this is not a partisan issue. I think the number one role of local government is public safety. And when the state literally handcuffs local governments and puts criminals in a better position than our law enforcement officers, think about this: my brother, who's now making a lot of money, can be sued for an arrest he made in 2006 without actually having anybody put their name on it. So a false allegation can be made against my brother, and he's back in court because he made an arrest back in 2006. So, but yet a criminal who made a similar offense can get away scot-free because he's got the regular laws of statutes of limitations protecting him. So I think we need to think about common sense, reform, and working together as a board. And again, putting the partisanship aside. At the end of the day, we represent the people, and the people have spoken on law enforcement and on supporting criminal, being against crime as a number one role for us as local officials. So and the entities that we oversee. So I would hope we can come together in the future and put things to a vote and actually have this board's voice heard. We've done it in the past. I've gotten Republicans to come over when many said that maybe we shouldn't be weighing in, and I'm hoping some of the friendly Democrats can do the same thing. At the end of the day, it's about the people. Thank you.
Okay, further discussion on the order of old business. Member Eckhoff was seeking recognition, and during Member DeCiani's remarks, Member Ozog raised her hand. So we'll go to Member Ozog next. Please proceed, Member Eckhoff.
Thank you, Mr. Chairman. I probably am the person who took off their mask when I was talking today, and I hope I didn't make Ms. Garcia or anybody else feel uncomfortable. I just want to note that the incredible amount of work that our staff has done to make this room safe. It used to be you had to be 6 feet apart. Then if you couldn't be 6 feet apart, you had to wear a mask. Now I'm 10, 12 feet apart from the closest person next to me. I'm wearing a mask 99% of the time, and I got 3 panes of plexiglass between me and that person. So, if somebody... It probably is just me, and I did take a bath today too. I don't know why, but anyway. So I understand the need for safety and concern, but our staff has done an incredible job, and I think we need to take that into consideration. But I'm not trying to make anybody feel uncomfortable.
Member Ozark.
Thank you, Mr. Chairman.
Second thing, just one other thing, Mr. Chairman. Regarding public comment, I was looking at our existing rules at the time we were debating about how much public comment to have. And 2 things. Number 1, anybody who wants to make public comment is supposed to fill out our form. And I'm pretty sure our form says name. I know the clerk read somebody concerned citizen. I don't think anybody who writes concerned citizen as a name should have their thoughts read into the record. Number 2, our public comment rule says remarks shall be confined to topics or activities which fall within the statutory authority of the county board. And as much as I agree with the people who want their children back in schools, I'm not sure that is within our statutory authority. So I was going to suggest that before county board meetings, either the clerk and the state's attorney try and figure out which items fall within our statutory authority, or maybe you, along with the vice chairman, try and filter out those that really aren't applicable and don't meet our public comment requirements. Thank you.
Okay, thank you. Member Ozog, followed by Member Chaplin.
Thank you, Mr. Chairman. I'd like to make a few remarks about the vote today about the resolution. First of all, I agree with Member Chaplin that this was a precedent that I believe we do not want to set. She talked about do we weigh in on every single issue that comes up that may be of importance to either side of our aisle here. She brought up abortion. She brought up there's so many issues. So in that regard alone, I agree with tabling this resolution. The other issue that's come up was politics and how we use politics. And at our last meeting, which was soon after the unfortunate, terrible events of January 6th in our capital, Mr. Cronin referred to a kinder, gentler board. And I'd like to point out, several of you today have referenced the referendum questions. And I was against the referendum question. And what I said at the time was that I felt it was a question meant to stir up our constituency and infer that those of us who did not agree with it did not agree with funding law enforcement. I have completely voted in favor of law enforcement on this board. Yet a TV commercial was made using 3 of us board members who voted against it and claiming that we were not in favor or something to that, alluding to that fact because we did not vote for this referendum. So going forward, it would be really something if this board consider that we use our other board members' words truthfully. We tell the whole story. I think that would be a really good start for this year. But as for this resolution, I don't believe we should have entertained it in the first place. It's not our job. It's Mr. Berlin's job as an individual elected official. It's Mr. Sheriff Mendrick's job. And if they want to comment on it, and that's fine, but this is not our job to comment and ask for vetoes of legislation. Thank you.
Okay, further discussion on the order of old business. I think Member Chaplin was seeking recognition.
Thank you so much, Chairman. So I forgot a very important part of my speech. I left all of you a little Kawasaki awareness bracelet, so you'll have those in your lockers for those that aren't here today. But also, I wanted to mention that a former board member, Irene Stone, passed away on January 16th of this year. So Irene served in my district, District 2, and she served 6 terms on the DuPage County Board. I met Irene when we were trying to get safe water, and she was very open. She took my phone calls. One of the few board members in my district that really took the time to talk to me. Those few phone calls led to somewhat of a friendship and kind of a mentorship. And when I ran for office in 2006, she supported my efforts, and we kind of. Like I said, we had a friendship and a little mentorship. So I just wanted to, put those words out that, a member of this board did pass away just a few weeks ago, and I thought it would be appropriate to mention that.
Sure. Why don't we do a quick moment of silence for Member Irene Stone. Okay, thanks, Liz. That was nice. Anyone else seeking recognition on the order of old business? Old business. See, there's Sam Tornatore. The camera panned over to you, and there you are.
Thank you, Mr. Chairman. Just one comment regarding the politics and whether or not we have a right to weigh in or an obligation to weigh in on legislation in Springfield. We've weighed in on income tax that has affected our county. We've weighed in and had significant discussions about COVID relief and what goes on in Springfield and the money that came to us, which was as a result of legislation. We go to Springfield to meet with our legislators, and we have a legislative committee. To suggest that we should turn a blind eye to what goes on in Springfield and not comment on it, I really do think misses the point entirely. And to suggest and throw out things like abortion or whatever, which obviously are not within the purview of the county board, is simply a red herring. Let's discuss things that have relevance to the county board. And again, I hate to even use the word politics in this county boardroom, but it seems that we have to do it every week, whether we like it or not. Thank you, Mr. Chairman.
Okay, thank you, Member Tornatore. Member Chaplin.
Thank you so much, Chairman Cronin. And yes, I agree. We do take positions on legislation. We've opposed and we've supported. But to my knowledge, we've never done a resolution asking the governor to veto or to support a bill. I mean, to me, it's unprecedented. And I think when it gets to this stage, it's too late. I mean, they've discussed it down in Springfield, and that's the decision they made. It's up to the governor to sign it or not. And if the governor signs it, we're going to be discussing the bill in JPS, as Member Schwarzy mentioned. So Member Renahan has it all under control. We're going to be talking about that bill in JPS. We're not trying to squash the discussion of the bill. What we're trying to do is keep politics out of the board floor, because like I said, if you open this up for starting to have the governor putting resolutions to veto legislation, where does it stop? I mean, I think it's a little bit it's really out of our scope of work, I would say. And I do agree, we've taken positions and things like that, but this was just out of our jurisdiction.
Well, I think people will agree to disagree about that because we had a robust debate earlier and we listened to the state's attorney, but there are still others seeking recognition and want to go back to this discussion. Member Covert, followed by Member Zay.
I just heard what Member Chaplin said about how we don't take positions, but When I started out in my first term, Member Chaplin, didn't you take a position on the RHA bill as a county board member in the Chicago Tribune? There's an article on that which I had stated when the Chicago Tribune approached me, and I specifically said that the RHA bill is not a county board issue. I will not be commenting on that. So I believe that people did take a stance on the RHA bill at the beginning of my term, which is clearly not county board related at all. So I'm just confused why you said that.
No, I said that we do take positions on bills in this boardroom.
Okay, further discussion, Member Zay, followed by Member Ozog, followed by who knows who at this point, at that next point. Please proceed.
I just don't want to end, Mr. Chairman. I'm just so glad today that after, 2 decades on the board, that board members can tell me what my job is and what my role is and what I can do and can't do. So I just put things a little clearer into perspective today for me. So thank you, Mr. Chairman.
Okay. Member Ozog.
Thank you, Mr. Chairman. That is the exact point of today. Member Chaplin can make a comment about the RHA bill. Member Zay is perfectly free to do that. All of us do make various comments, social media, to our constituents. But the point here was that the entire board was being asked to take a stand on legislation and ask the governor to veto that. And that is something that this board has not done, and I still believe it's beyond their purview. We all have First Amendment rights, and we can all certainly talk about our positions on anything. But to ask the entire board to do that changes the equation here. Thank you.
Member DeCiani.
If I could remind you, many of us, and I appreciate it, voted for the resolution that called the governor out and the state legislator for not covering kids with autism for Medicaid. And while Member Larson initially fought me in committee, saying that was a state issue, not a county issue, I reminded him that 1 in 3 kids in our county are on Medicaid. And many of those kids, we have a lot of kids in this county that have autism. 1 in 54 today are diagnosed with autism. So we have passed resolutions to tell the state and the governor what to do and how we feel about an issue. And Member Ozog, you supported that, and I appreciated that. That was important to me. So this is something we have done in the past. Many of you, Ms. Chaplin, supported that resolution as well, and my vice chair at the time, Ms. Renahan. Those were important things. And actually, I think, Julie, remember, we had a couple of Republicans that said, what are we doing here? Why are we taking a stance? But, this does affect our community. It affects DuPage County. It affects 1 in 3 kids. And I was proud that we did that. And guess what? The governor acted. The governor, listened to us and put $42 million in the budget for Medicaid for kids with autism. So they do hear us. They need to hear us. And, public safety, again, the number 1 issue in this county, is something that we should be heard on, and it's not irrelevant. We're not taking a Trump vote or a abortion vote. We would never do that. But something that's important, that's the number 1 role of local governments, and a law that affects this, I think, no matter what side you're on this, is something that could be heard. Thank you.
Okay. Well, thank you. Very enlightening. Anything further on the order of old business? The whole process was very enlightening. I didn't mean to diminish anyone's remark. It's good that we have these discussions. I think we can find examples of going either way for as long as I've been around. But in any event, anyone else seeking recognition on the order of old business? Seeing none, hearing none, we move on to the order entitled New Business. New Business. Member DeSark.
Thank you, Chairman. I've been in communication with Cheryl Marquet, and I just wanted to let everybody know that because we're running an hour and a half behind, unfortunately, Senator Curran and State Rep Conroy have both indicated that they would like us to reschedule them, so they will not be at the legislative meeting. However, we still do need to meet for a moment just to vote on the 2021 state legislative agenda, and IT needs 15 minutes to set up. So from whenever this meeting stops, set your timer for 15 minutes, and we'll still go ahead with the legislative committee meeting. Thank you.
Very good, Member DeSark. Thank you very much. Member Renahan.
Thank you, Mr. Chairman. Just a reminder to everyone, the DuPage Care Center Valentine's Day fundraiser is underway. So from now until February 10th, they're accepting it's $4 per balloon, or cash donations are certainly welcome. And the money goes to all kinds of good things like art supplies and music and things to help our seniors have a little bit better days. That's all.
They're using helium tanks to blow up those balloons, right?
Are they using helium tanks? I mean,
I hope so.
I don't know. All I know is none of us are invited this year because of COVID. So.
Oh, good. That's good. That's the right thing to do. Anyone else seeking recognition on the order of new business? New business? Anyone? Seeing none? I do know that we do not have anything to come before us on the order of executive session, so I will entertain a motion to adjourn.
So moved, Rutledge.
Second, Chaplin.
Second motion by Rutledge, seconded by Chaplin. All those in favor say aye.
Aye.
Opposed, nay.
Aye.
The ayes have it. This meeting has been adjourned to Tuesday, February 9th at 10
Roll call.
a.m.
Roll call.
Roll call.
Roll call.
Clerk, please call the roll.
Rutledge.
Aye.
Schwarzy.
Aye.
Selman.
Carter, sorry about that.
Selman.
Aye.
Tornatore.
Aye.
Zay.
Aye.
Chaplin.
Aye.
Chavez.
Aye.
Covert.
Aye.
Desart.
Aye.
DeCiani.
Aye.
Eckhoff. Garcia.
Aye.
Hart.
Aye.
Krajewski.
Aye.
LaPlante.
Aye.
Ozog.
Aye.
Pachowski.
Aye.
And Renahan.
Aye.
Okay, thank you very much. The resolution to adjourn the meeting is adopted. This meeting has been adjourned to Tuesday, February 9th at 10 a.m. Have a great week, everyone. Thank you.
Have a great week.